more so than stayed on the pain of that. I think we have celebrated his actual life. Tyree was he was a bright light to a lot of the people here in Sacramento. He enjoyed skateboarding. He enjoyed just kind of being with his friends before moving to Memphis, and his family and friends all here in Sacramento just really were heartbroken, but also very proud of the young man that he was, and are hoping that some good will come from his death.
We all too often these days are having to say those exact words. We hope something will come of their deaths. And Jackie Rowe Adams personally experienced this kind of tragedy twice over. If you could share with us how that has personally impacted you, your family and the community, and how you have turned that grief into action. Jackie, are you there? I think she may have frozen. Yeah, I think she is frozen. So, Larry, what is? We'll go back to you, or Kimberly,
Sure.
or well, let's see if Kimberly is there. Kimberly, are you there? I think you're muted, Kimberly. Oh, there you are. Can you turn off your? Can you turn on your sound?
Yes. Can you hear me now?
Yes, we can. Thank you. You've also had personal experience with gun violence. What are the effects of grief that we don't see, that ripples out and spreads across the communities and across generations?
Well, what you don't see is you understand that the person was killed, and after that, pretty much everybody else goes on with their days. But as a mother of a child killed, we have to remember that every day. And not only is it a void in our family, that person could have had a staple in our society. That could have been a future doctor, lawyer, anything. So it's not just the family that has a loss, it's the community as well.
And the community itself, I mean, what is your organization doing to help combat those losses?
Well, with Protect Our Stolen Treasures, we help the families that have had losses. We have places where you can come together and fellowship with other parents or family members who've lost people. We do a lot of community engagement to make them aware of what's happening. And, we're just a support system. Because when we started, there was no support for us. There was no one out there to show us the way. So Protect Our Stolen Treasures, which we like to call POST, we are that bridging gap to give support and help the next person, which we don't want to see the next person in areas we didn't know
about. All right. Now, Larry, we'll go back to you. So in the immediate aftermath of the most recent incidences, what has gone on in your community?
Sure. I mean, I think, well, I'll take it in the context of the observer's role and what we've tried to make sure that we do as a newsroom, particularly in the light of so much gun violence that we had in 2022. We started as a newsroom to kind of look at some of the data that was accessible and was findable, about really the challenges that particularly some of the mass shootings that we had been having in our community. And, obviously they define mass shootings, I think, with where 3 or more people have been shot. what we found was about 60% of the mass shootings really stem from some sort of domestic violence altercation. And that the perpetrators of the mass shootings most likely had some sort of domestic violence charge on their history. And that was to us was something very eye-opening, and it's an issue that we think is grossly underreported. The amount of domestic violence occurrences that happen, and then the fact that a perpetrator of such a horrendous act can have access to any sort of firearm is, really something that's unconscionable. And again, you talk about, how can we move from, sorrow to some sort of solution? I think one of the things that we're facing. I'm getting an echo in my own head.
I think we're getting Jackie back. We had sound from her for a moment, and now
Okay.
I think we've lost her again. Oh, there we go.
I think I'm here. Could you hear me?
Yes, we can hear you now. Yes.
Yeah, my other computer froze. I'm running around trying to change computers. You know how we do. But thank you so much.
So happy to have you with us. And so what I was asking you before is, you've personally had experience with you've personally had experiences with tragedy, and I was asking if you could share how that has impacted you and your family and your community, and how you've turned that grief into action.
Well, first, let me say thank you so much. I lost 2 kids to gun violence. And trust me, turning that grief into action was not easy. Giving honor to God, and I have to say that, God brought me through, along with a lot of support from the community, from the team. Well, my first son, I didn't know anyone that have had a loss. So I was like in shock, still in shock, of course, but church and my parents and family was my support team. You need that support team. And you live in shock for a long time, trust me. And so who would think 16 years later that I would lose a second son? And losing that second son, I had more support. I had people around me that say, Jackie, you're not alone. You're not alone. And that's when I took to the street and reaching out. And that's how I was able to turn that, pain.
Oh, it looks like we've lost her again. That's one of the problems with unstable internet connections and being in communities of color around this country. I mean, one of the things is that infrastructure is really a problem. And when it comes to trying to get the support that we need for our communities, even when it comes to little things like stable internet, we have problems. And when it comes to getting the little support that we do have and continuation of care and support for whatever services that we do have, we continuously have issues. Now, Kimberly, your organization, Protecting Our Stolen Treasures, what is the main thrust of the organization?
We always believe that all deaths require responsibility. And dealing with the police departments, we 90% of the time don't get that responsibility of the loss of our children. So we're in the process of changing laws where those deaths are going to be responsible for, and someone's going to be held accountable.
Okay, so it's accountability.
Yes.
And making sure there's accountability. Okay, thank you. Now, so Larry, when it comes to reporting on gun violence, Is the Sacramento Observer is starting to look at the way you're covering gun violence and, working on new ways of covering gun violence along with the Amsterdam News.
Sure.
Because we've realized that it's not, the old ways of doing it are just not working.
Sure. Yeah. I mean, I think to your point, absolutely. And what I was saying earlier was about how we had, done research about how 60% of the mass shootings and in our region were perpetrated by people who had domestic violence history on their domestic violence charges in their history. And so we did a series of stories last year that were focused on really kind of addressing that. One of the biggest challenges that we all face is that there's no real data, particularly related to domestic violence charges. And so we've been really working very hard at changing the narrative, trying to make sure that our lawmakers understand the impact that domestic violence is having in our communities, and the ripple effects of that. If you could imagine, just like we're talking, if 60% of those shootings are from people who have domestic violence in their history, what could happen if you took that 60% off of the books of those that have been, who have that in their history? So I think it's critical for us as newsrooms to look at this differently. I think the other part of it too, and let me make sure I acknowledge this work has been done by our health equity reporter, Genoa Barrow, who's a fantastic journalist and reporter. And we hope that, some of the work she's doing is helping to save lives. But one of the other things that we're really trying to pay attention to is really, what does healing look like? Because, I know we definitely want justice for those that perpetrate violent acts in our community, whether it's law enforcement officers or those within our own community. We want justice. But I think a bigger picture that we need to look at, as particularly from the Black press perspective, is what does healing look like? Because sending someone to prison where the prison is not rehabilitating or offering some sort of support for either the victim or the perpetrator, that doesn't necessarily heal our communities. And I think we've been really trying to look at that very critically from a journalistic point of view, through the lens of the Black press. How can we heal those that are incarcerated and those who will be getting out of prison? And how do we heal those families that have gone through the horrible loss of losing a loved one?
Now, Kimberly, how do we support the families that have lost loved ones?
Well, they all need financial support. A lot of people, when they lose their children, don't have life insurance or things like that, and that's a barrier. They also need emotional support, where they may need this to a counselor or something. And in the Black and Brown community, we don't speak a lot on counseling. So we need to get more in tune on counseling helps. Financial is always good because they're inner city, so they usually don't have amount of money to take care of what they need or bills or anything like that. Once you lose a kid, the last thing you're thinking about is what you're supposed to do as far as your regular day life, because your emotions is on that loss. So with Post, we try to help out with things like that.
That's something that is so important. That is one of the things that we're going to be getting much more into as we continue our discussion, and the work that we're going to be doing with Beyond the Barrel of the Gun is really talking about what happens after the cameras leave, the journalists leave, everyone leaves, the families and the communities, is what is going on in the communities, in the schools, in the churches, everywhere, in terms of emotional and mental health support for the communities. Who is there for people to talk to? Are there counselors? Are there services? And what are we actually seeing? And when everything else goes away, does all of that help go away? Are people able to find the services that they actually need? Kimberly, what are you actually seeing? Are they actually able to get those services that they need, or is it a difficult process?
It most definitely is a difficult process because there's a lot of people who are uninsured and they can't see a specialist, or they're uncomfortable with seeing a specialist. In the Black and Brown community, there's a lot of people who I'm going to say frown up on seeing someone. There's a speculation that something's wrong with you, but there's nothing wrong with seeing somebody to speak with. And we have to just get out and bring awareness. Now, it doesn't have to be a killing, sometimes just life itself in the inner city is hard. So there's a breakdown, and we need more people out here to help these people because there's a lack of it.
So Larry, I mean, there's a stigma in the Black community with mental health support. Do you want to talk a little bit about that, especially from a newspaper's perspective? I mean, because we've seen it a lot.
Yeah, no, absolutely. I mean, I think what Kimberly said is absolutely correct. Even as we were again, we have spent a lot of time, particularly in this this correlation between domestic violence and gun violence over the last year or so. And one of the things that is an ongoing challenge is getting particularly men, and I would say, very clearly, getting Black men to participate in mental health support services. There are programs, and we have some in Sacramento. I know that they're all over the country where, where people are in the organizations are trying to get men to open up more, to discuss, really the trauma that they're dealing with, and the effects of that trauma. There's the old adage, hurt people hurt people. And so the idea that we've got, so many men, particularly Black men in our communities, that are walking around hurt, and oftentimes of no fault of their own, but they are just hurt, they're damaged, and the challenges of getting them to be open to addressing those challenges. There should be no stigma about it. If you were having a heart attack, you would go to the hospital and try to get somebody to help you with that heart attack. If you are having any other sort of physical attack, you would see a specialist related to that. If something was wrong with your foot, you'd go see a podiatrist. If something is wrong with your heart and your head and your emotions, you have to see someone to help you deal with those things. And there shouldn't be any stigma with it, but it is a challenge, an ongoing challenge that we're facing. And God bless Miss Davis and the work that she's doing to kind of help those that are going through that, because that is definitely, particularly again, as we look at the correlation with domestic violence, we definitely see that, and there's a lot of need to address that.
And as we look at the Black church, for instance, is that one of the solutions? Is the Black church a way to go around those that are very reluctant to go looking towards a psychiatrist or a psychologist because maybe they will go to their pastor instead?
I don't know if Ms. Davis
Kimberly,
wants to answer that first.
did you want to answer that? Or
I'm going to say in Detroit, we've contacted churches, and as far as we go, as police brutality, churches really don't want to help us because we're going against the police. So we have a lot of defiance. We don't get help, and they're not willing to reach out because They don't want to go against law enforcement, but law enforcement is going against the Black and brown community.
But we're talking in the larger sense of those dealing with grief in general. And we're talking about mental health services and the impacts that are just really not seen. I mean, because, you know, there are the wounds that are seen, and we know that people hurt, but there's also the unseen impacts of gun violence. What are the longer lasting effects that are not seen by the people that just read about it?
The children of the deceased, you know, they have to go their lifetime without a parent, and their parents of the deceased, they have to go with the what ifs. You know, you never imagine your child leaving the earth before you, and if they do leave the earth, you always wonder what could have happened, what could have your child been in society. So people don't see that. After the article is over, most people go on with their lives, but the families of those victims, we don't. Every day I wake up and I know my son isn't here and he's never coming back again. But you may have heard of the story, and after a week or so, Kimani Davis isn't in your mind anymore. But I wake up every day and I know Kimani Davis isn't with me. Kimani Davis can't be a part of society. Kimani Davis can't see his son grow up. And those are things that will happen for the rest of our lives.
And that is part of that generational trauma.
Yes,
that continues, and if not addressed, may continue for generations to come. And those mental health services that we've just been talking about need to be available for all those around. And now we do actually have Jackie on with us again. Jackie, are you there?
I'm here. Can you hear me?
Yes, we can.
I'm so happy. Oh my goodness, I was so embarrassed. Oh my goodness. When I get more money, I'm gonna get some more new computers.
Well, I'm glad to have you. And so as you were saying before, you were telling us about your personal experience with tragedy.
So let me just quickly, and I know time is running, but let me say that tragedy, you would never believe that something like that would happen with losing two sons. That's the second son really changed my life because I'm still in shock. But I was fortunate enough to have a support team. That's got to start with that. And God in my life. I went out and found other mothers. I heard about lost their kids. I talked to 5 mothers. I put 4 mothers together. And what changed our lives, we said, enough is enough. We sick and tired of being sick and tired of putting the blame on the police, putting the blame on the teachers, putting the blame on everybody. Let's take back our kids. Let's take back our community. Who's giving our kids these guns? And that's the mission we went on. And we talked to so many electeds. We talked to Keith Wright. We talked to the 100 Black law enforcement helped us, stood on steps of City Hall, with now to be our mayor. Eric Adams was the sergeant at that time and called the question. And that's how we survived. We had each other. We knew each other pain. We knew the hurt and pain that we were dealing with. And that's how we survived with 5 mothers. Now I'm proud to say we have 50 plus mothers and fathers. I'm sad to say because of that, but we have now 50 plus mothers and fathers. And we realize that we cannot bring our kids back. So I decided to help another mother, another child, another family from feeling the pain and hurt and sorrow that I was feeling. So that's what motivated me to start Harlem Mothers Save. And now we have so many fathers, we have Harlem Mothers and Fathers Save. But when you sit in a group and you hear somebody else's story, you'll take it off of you and say, you know, my story not that bad. Listen to what she's saying. And that's how we all come together. That's how we deal with some of the grief and pain. So that is what we need to survive. But it's not easy. You don't get ever get over this. But you learn to deal with it. And if you have other kids, you have to focus. We say to them, focus on your kids because you're not alone. But focus on your kids because your kids is dealing with the grief and pain, and you would never know it. And they're planning, a lot of these kids have grown up and plan revenge. So these are the things that we deal with in a support group. We have counseling. We deal with the trauma. We have doctors on hand. And that's how we did. I heard that we were better than the psychiatrists because the psychiatrists give pills. They come live in our meeting and we talk to each other. So, and they're not drunk, and that's how we make it. I know, and I am a fan of Not Another Child, but I think Arisa Napa would say, Jackie had one of the best support groups in Harlem. And I am proud to say we have citywide groups, and we've worked with other groups such as Not Another Child. But the grief is very, especially now when that COVID came. When the COVID came, it changed so many people's lives. They got to know each other. They was in the house together, and a lot of that mental illness came. A lot of them, oh, you don't know how many people want to commit suicide. Then a lot of murders start coming.
So what do we do about that when they don't have the mental health services that they need, when they don't have support groups like you're able to provide?
So what we do is we reach out, we have to, as a community, we have to take back our kids. We have to take back our community. We have to send them and give them the resources that they need. I see that Erica Ford is on. She have groups. Everybody have to take charge because I'm going to tell you, it's not just a one-man show or a two-man. Everybody, and I see you're taking charge now. I want to thank y'all, Amsterdam News. So what do? We have to find and build that team, build that support group, and let people know we have to give resources. We have to make sure they know where other organizations out. That is our job. That is our job, to get in the community, go out to the schools, go out, let the churches speak out. The churches got to open their doors, okay? We have to go to the community boards. We have to sing it, tell it, and shout it, because it is people out there that don't know it's support teams. But we got to continue. The media have to step up a little more and put stuff out there. So that's some of the things we do. That's some of the things we do. And we have mothers and fathers that come to the group that really don't know where to go. But thank God that we are here to make sure that we could refer them to other places. Thank God.
We know some of the violence has to do with gangs and drugs, but we've also talked about, and Larry has talked a lot about this as well, that some of it is domestic violence and family violence. And that impact of domestic violence and family violence is very real. And we've seen a lot of it lead to a lot of gun violence. And how is that affecting the communities differently than the gun violence that is led from gang violence and drug dealing and things like that?
Well, first of all, a lot of violence comes from domestic violence. If you just heard some of these cases, recently, a lot of domestic violence is taking place, a lot of shootings, and a lot of it is from domestic violence. But a lot of this violence, period, I always say, and some people get upset, we just have black on black crime. So let me just say it like that. We just have black on black crime, but a lot of it is domestic, and they report domestic violence, and sometimes it's ignored. So that's another thing. We have to take domestic violence serious. I work with WARM, Stephanie McDraw. I work with WARM. And a lot of domestic violence is happening. And WOM is on top of it. But we got to do more. The precinct, they got to do more. They have to do more. And we have to open up more housing and places and shelters for these battered women, battered men. We have the domestic violence on men too. So it's not really that much different. The difference is we are killing each other at a young age, and that's what's happening now. We are killing each other at a young age, but we have to get the right resources. We have to get the resources to help these programs and to save our children. We really.
So how do we motivate our leaders to actually get us those resources? And this is open to all of our panelists here.
But let me say, legislation, the elected officials really got to step up. Okay, how do we motivate them? We don't vote for them. Let's vote them out. Let's go to the poll, take it out the poll. That'll motivate them. Some of them take our vote for granted. So my motivation is when it's election time, you have to remember, do not put the same person in that don't want to give resources, that's not doing anything for us, that don't come out and support these rallies and these kids, or support the anti-damn news when they're putting stuff out, or supporting the media, or supporting the mayor. You have to support the mayor on a lot of these issues because his belief, he is really fighting this gun violence. So the motivation is, for me, is to keep singing it, telling and shouting, but you will not get my vote when election comes.
All right, Ms. Davis?
Well, I agree as well that we do need to make sure that the people that say they're for the people are definitely for the people. And if they're not for the people, we need to get them out and get new blood in.
That's right.
And we also need to hold them accountable for their actions.
That's right. That's right. That's right.
And Publisher Lee.
Yeah, I mean, I would agree with both Miss Jackie and Miss Kimberly about that. I think that we have to be persistent with the ringing of the bell, if you would say, to make sure that the squeaky wheel gets the oil. You have to continue to stay in front of this. There's now in this country, CDC reported last year that there's more of deaths by gun violence than there are automobile accidents now. Mm-hmm. Now we can get automobile legislation done with seatbelts and hold manufacturers accountable for how they create cars and safety protocols for cars for protecting people. But for some reason, we can't get any legislation done related to gun violence and to guns. So, we've got to continue to stay in front of that. We've got to hold, I know there's a lot of people that love their Second Amendment, and I'm not upset at that, but, you've got to be realistic and look at changing the access that people have to guns in our country. Whether they're ghost guns, real guns, I don't care what kind of guns they are, but there's too many of them.
That's right. And the pipeline, Ellen, let's talk about gun trafficking. That's how a lot of these guns are getting into our kids' hands. And that's some legislation that they need to pass. We've been fighting. So that pipeline is off the hook. Then you got legislation up in Congress where the Santos senator or Congress is talking about the AR-15 to bring back. So it's crazy. We really have our work cut out for us.
Well, it seems like in our communities, one of the things that happens is that it's not usually the legal weapons that are really the issue. It's the ghost guns. It is the illegal weapons. It is the ones that are getting trafficked from down south to up north. It's the ones that have the serial numbers scraped off. It's the ones that have been stolen. It's the ones that have gotten lost. It's the ones that been...
you say that, and I know I agree with you, Eleanor, but these gun advocates, they'll say stuff like, the it's better to have a good person with a gun than a bad person with a gun. So they want to have more guns.
Well, we
out
don't
there.
want any.
We don't
No,
want-
I know, but that's the argument. That's the argument
Right.
is you know,
But-
and you sit there and you look at you know, all the officers that were in Texas when you know there was a mass shooting there, and they've got guns, but they did nothing to help stop that gun violence in that
That's
community
right.
and that
That's
gun
right.
shooting. So
Yeah.
it's just it's good guns, bad guns, all guns need to be addressed. To your point. I'm sorry, I didn't mean to cut you off, Eleanor.
No, but that's
Yeah.
good. That's good. That's good.
But you're right there, Larry. In that particular case, we had people with weapons who didn't use them when they could have done something to stop something. And that's a whole nother question of what happened there. But we are coming to our last 4 minutes before we have to start our next panel. So I just want to know if there are anything you want to say in our last few minutes. I want to start with you, Ms. Davis. If you have any closing remarks that you'd like to make before we move on.
I want to let you know that the gun itself isn't killing people. It's the person behind the gun. And we need to do more with addressing the mental issues of those and the law issues of how they're getting the guns. And I think as our panels go on, we will come to those solutions. We just have to work together.
That's right. That's right.
All right. Thank you so much, Ms. Davis. Okay, Publisher Lee.
Actually, I'll cede my time to Miss Jackie because she missed most of the panel, and I love her passion. So I'll let her. I'll let her go. But keep up the great work, Eleanor.
So
Thank you.
yes, Eleanor, keep up the great work. So let me just say this. My last words for now is to say this gun trafficking getting in our young kids' hands, going to these schools, enough is enough. I want to say to the parents, talk to your kids. Check their book bags when they leave your house because it's getting younger and younger and younger that these kids are using these guns. Check their book bags. Look under your mattress to see what's in your house. Keep your kids engaged. Listen to them when they talk to you. They want to talk to you. They want somebody to talk to you. So it's time for the parents to step up more, keep their kids engaged. And I want to say to the legislators, stop killing our kids because you're killing them by not signing the right bills for us. Help us save our kids. And I want to address this to Andrew Cousin Stewart and Carl Hasty. They sitting up there. It's nothing personal, but I care more about saving our kids' life. They got bills that they could sign and help us a little better here in the city and in the state. And that is my last message. But parents, get on board. Save your children. You can do it. You can do it. Work with the mayor. Let's save these schools because it's always shootings around these schools. Enough is enough. Sick and tired of being sick and tired. Let's take back our kids. Let's take back our community and let's stop this violence. Thank you, Eleanor.
Well, I want to thank you all so much for being with us today. Thank you so much, Kimberly Davis, Larry Lee, and of course, Jackie Rowe Adams. Thank you, thank you, thank you. And in another minute, we will be starting our next panel with our investigative editor, Damaso Reyes, who will be leading it. And that will be starting in just a moment. Again, thank you so much again, Larry, Kimberly, and Jackie for a great panel.
You.
And we look forward to working on these solutions, and hopefully we will be able to, over time, eradicate this problem because we don't want to have to bury more of our children.
Oh, no.
Absolutely.
No, absolutely.
Thank you so much.
Thank you.
Thank you. Thank you.
Thank you all.
Okay.
All right, Damaso. Turning it over to you.
Oh,
Do
all
I
right,
get
thank
off
you.
now? Am I off now?
Yes, Jackie, thank you.
Thank you. Good.
Yeah. Thank you very much, Eleanor. And thank you to our previous panelists for joining us. We're going to get started with our second panel now, right on time. Let's see if we can keep that going there. And for the next 40 minutes of our virtual convening, we're going to have our second panel will focus on the challenges to finding solutions to gun violence in Black and Brown communities. My name is Damaso Reyes. I'm the investigative editor for the Blacklight, the new investigative unit at the Amsterdam News. Actually, we're not that new. We just celebrated our first anniversary last week. And we're also the first investigative unit at a legacy Black newspaper. If you have any comments or questions for our panelists, please put them in the Zoom chat, and time allowing, we will do our best to address at least one of those questions. So let's go ahead and dive in and get started. Let's see, do we have all of our panelists here? I think we do. Make sure you turn on your cameras if you are a panelist. I think we are getting everyone in place. Let's see. All right, we're gonna go ahead and get started with our panel. And so I'm gonna do a brief introduction of our panelists while we continue to get everyone on board. We have Denise Barnes, who is the publisher and second generation owner of the Washington Informer, which serves the greater Washington, D.C. metro area. She's also, in addition to serving on numerous nonprofit boards, she is the past president of the National Newspaper Press Association, which is an advocacy group for newspapers of color in the United States. We also are really honored to have Erica Ford, who's the founder of Life Camp Inc. and is a world-renowned human rights activist and anti-violence leader. For more than 30 years, she has impacted the lives of thousands of Black and Brown people in vulnerable communities. And so we're looking forward to hearing from her. Next up, we have Cuco Rodriguez, who's the program officer at the Hope and Heal Fund. Prior to joining the fund, Cuco served as a program officer for the W.K. Kellogg Foundation, was a member of the foundation's racial equity and community engagement team. And last but certainly not least, we have Dr. Charlie Branas, who's a professor at Columbia University's Mailman School of Public Health and has conducted research that extends from urban and rural areas in the United States to communities across the globe, focusing on incorporating place-based interventions. Thank you, everyone, for joining us. Denise, I want to start with you, if that's okay, and talk to you not just as a publisher, but as a mother of young Black boys. How do you balance the safety and security concerns you might have with giving your children the freedom to grow up? And also as a Black publisher, your other important hat, how big a role do you think the mainstream media plays in actually being an obstacle to helping us find solutions to gun violence? Is Denise not with us yet? Looks like she might not be with us. Oh, sorry about that. Well, we do have Erica, who certainly has some perspective on this. You have very deep experience in gun violence interruption. Give us your perspective on how you think why you think the government and other financial investment flows disproportionately towards criminalization versus the kinds of long-term solutions and proactive and preventive solutions that you highlight.
Thank you for having me here today. Greetings, everybody. Racism, oppression, discrimination, the people who get killed, the people who get shot, are Black and Brown people in Black and Brown communities. And when we look at investment period in those communities, when you talk about real equity, when you talk about real sustainability, when you talk about building a system that can eradicate some of the oppression that people find themselves in. That's not what is being invested in. What is being invested is band-aids, you know, and quick fixes, and not really resolving a systemic issue in a real sensible way. And so we'll invest in criminalizing and locking people up, but we won't invest in helping people heal from, you know, for example, we're looking at now people getting legal license like we got from the question of the war on drugs, right? And the war on drugs was something real in our community. This background is not really, the war on drugs is real in our community. It took a lot of lives and it destabilized a lot of people. And so there was never no resolve. There was never no healing. There was never investment in people in our community. And so, you know, those type of things don't get invested in.
And Erica, just to follow up on that, how central do you think this is to solving this public health crisis?
Can we take this background off? Can we take the background off of my thing? Go ahead. I'm sorry. How what?
I was just asking how central this misallocation of resources is to preventing us from solving this public health crisis.
It is extremely essential. I mean, what we do works. When we set forth to do the New York City crisis management system, we help make New York City the safest big city in America. We help secure a week where there was no one killed. That's historic. We had a weekend where absolutely not one gun was fired in this 8 million billion city of New York, right? And so when you would look at something like that, and if y'all could really take the background off of this thing, it's not working for me. But when you look at, why not invest in that? It works, right? Why not? Anybody in a logical sense would increase that whole process of what the New York City crisis management system was. More arrests and stop and frisk and more police, it's not working. It's criminalizing and terrorizing a community. And it's creating the instability of how we look at two cities in New York City. And so it plays and then when you look at COVID, right? All the premorbidities of the people catching COVID was because of the lack of resources in those communities, right? And so when you look at the disease of violence, you have to help cure the community, right? You have to help people heal, and you have to invest in the mind shifting of those individuals, and that's not what was happening. The criminalization, the more police, like that's easy. It doesn't require nothing to put a cop and say, "Stop! I'm gonna arrest you." That's nothing. But to talk someone off a ledge and get them to put that gun down and make a different decision on how they were going to address that interpersonal conflict, and then help that family heal after that killing, after they lose their child, so that they don't look to take another child's life, or they don't look to take their own lives, right? Those are real things, and it impacts tremendously when our city, our government doesn't invest in the people who need it the most.
Thank you. And Erica, we are working on removing your background. So hang with us, or we apologize.
All right, thank you.
Hugo, can you talk a little bit about the challenges to finding sustainable solutions to gun violence? Because a lot of our society is really focused on these short-term things, putting cops on streets, doing stops, trying to find guns, but we've been doing that for a while and it doesn't seem like it's sustainable. So can you talk to a little bit about what are the sustainable approaches that we can take, and how difficult are those approaches to find and to fund?
You know, I don't think that as Erica pointed out, finding solutions is not difficult. I think it's important for us to recognize that despite national legislation, despite in many cases state legislation, the folks that have kept gun violence at bay and or decreased it in communities of color in particular have been community-based organizations, absent systemic support, institutional support. So I don't think the solutions are difficult to find. I really can't help to think that, and I've said this before and I'll say it again, that Black and brown communities and communities of color would do well if institutions and politicians really stopped trying to help us without including or talking to us. And I think that, in 1994, President Clinton signed the crime bill. Most notably, it included a ban on assault weapons, but it also provided for the hiring of 100,000 more police officers. It also provided grants to build and expand correctional facilities for states that enforced what they called mandatory sentencing, basically ensuring that people serve no less than 85% of their sentences, which really incentivized three strikes laws and the such that really didn't help our communities, compounded by the war on drugs from previous administrations. And there we have kind of a retrospective view of generational destruction and trauma of our communities. And I point to all of that because really the difficulty is not finding the solutions. The difficulty is navigating a rigged system that doesn't work for us. The current administration has a lot of incentives, as Mr. Schumer pointed out. But one of the things that he pointed out is he had to step in and say, making sure that the funding that was allocated in New York went directly to programs. So even though the current administration is looking at some really good things to address issue of gun violence in communities across this country, in a lot of ways, it's two steps. It's one step forward and then 10 steps back for our communities over the next 4 years, because it continues to fund and support a lot of the issues that I just talked about that have compounded the criminalization of our communities. And again, even when we win and even when there is additional funding for, like example, for CVI, most states are not equipped to process those resources unless they are through law enforcement. So even when we win, we're celebrating this is a great political win in terms of policy change. But at the end of the day, when it hits the ground, it never hits the ground because most states are not equipped to even release these funds directly to communities. They are, however, equipped to very quickly promote these funds and, again, disseminate these funds through law enforcement. And that's really what ends up happening. So I think that finding solutions, they exist all over our country. They exist at community-based level, and they're the ones that are responsible for reducing or curtailing a lot of the gun violence that we've seen in the last 10 years.
Thank you. That's, I think we're going to circle back and explore a little bit of what you just raised. Dr. Brannis, the Amsterdam News has been calling gun violence in Black and brown communities a public health crisis for well over a decade. And now our politicians seem to be, and other leaders seem to be catching up with us. But from your perspective, as someone who studies this, what makes this violence a public health crisis? Because it's very few other people frame it this way. They mostly frame it as a law enforcement issue, maybe as a political issue if we're talking about gun restrictions or gun rights. But why do you think that this is a public health crisis? And how do we explain that to people who maybe are unfamiliar with this concept?
Yeah, so I think there are two basic reasons for that. And I'm glad to see that. Thanks for inviting me. And I'm glad to see that you all have been doing this for a decade or more. Because we really do need to place a public health lens on this. If you ask most people what happens when a shooting occurs in communities, the vast majority of people, including in New York City, will talk about the police responding to that shooting. Sadly, people forget that the medical system, there's going to be emergency medical technicians, there are going to be firefighters, there are going to be emergency physicians, nurses, and others on up in the worst cases to a surgeon and at times the morgue as part of these shootings. Those medical and biomedical entities are all part of the public health system. So that's a main thing. And that is a massive, the public health system is part and parcel, an equivalent partner, if not more, in the response to gun violence. The other thing I would say is the public health system and public health lens and thinking goes well beyond simply responding. That includes whether the medical system is responding to a shooting after it happens or the law enforcement system is happening. Public health is thinking about preventing these things from happening in the first place, going far, far upstream. Far upstream and dealing with the challenges that you see before you in communities, on streets and day to day, but then going even further upstream and attempting to change the very structures that are leading to this in the first place. The remnants and the challenges of structural racism that are very evident in communities right now, public health wants to change those. The disinvestment that someone mentioned before, public health is seeking to change the challenges of that disinvestment that people see. By the way, they see in their homes and outside their homes and their schools every day. Public health is the actor and the group that is really thinking about that. That is not really the law enforcement community. So I think a public health lens here is vital for two reasons, because it's being involved regardless of the medical system, but also because public health really is about proactive solutions and prevention, what we call primary or even primordial prevention from the very first instance or risk of gun violence in communities.
Thank you. I see that we have Publisher Barnes has joined us. We want to welcome you. And we want you to, if you could provide us some perspective as a mother on how you view this issue, how you balance these concerns of safety versus security versus obviously your children as they get older wanting to spread their wings.
Yeah, thank you. And I apologize. I was watching on another hookup here and couldn't get in. But anyway, I cut that off. So I'm glad to be here. And I've really enjoyed and appreciated the remarks I've heard earlier. I want to say, you know, through the grace of God, my kids now are in their mid to late 30s, 2 males. But I have to say that, unfortunately, they came through at a time when the gun violence was not as severe as it is right now. But there was always the lure of a lot of things that were happening in the streets, particularly here in DC, that often caused me grave concern, and not only from their peers, but from the police as well. They've had their encounters with both. And I've encountered some of those things along with them. So, you know, but I think it was important for me, not only as a mother, but also as the mother of young men who had lots of friends that I still continue to mentor. You know, I've heard a lot today, and I guess if I took my editorial hat off or my publisher hat off, I would be sort of still at a loss. I mean, I'm hearing, which I agree with, the importance of looking at public health. I think education in our schools play an important role. I think our faith community and our churches play an important role. And of course, parents play an important role. And when I ask people these days about what they feel is the challenge for our young people sort of getting on the right track, and it's what's missing in their local communities, it's in their households, it's in their neighbor's household. It's what's going on that they see, that we can see, or that, you know, that sometimes we don't see because they, you know, are off in other places. But, you know, it's a concern. Listening to the mothers that you had on earlier in the previous segment, I feel their pain. I know, and I live in a neighborhood where I hear gun violence every single day and night, police sirens, all of that consistently. And I have to pray for those mothers and those young people that are out there, but they're not hearing this from our perspective. You know, they know that money's being transferred from place to place. People are getting money for grants. People are getting money for, you know, the police are making money. Everybody's making money. So they're out there trying to make some money too. But they don't understand, I don't think, always the consequences, you know, and we're fueling an industry. These kids are fueling an industry. And I don't think they understand, you know, how much this gun violence is helping to help other people to pay their bills, you know, to send their kids to college, So that's part of the conversation that I try to have with them as much as I can and as often as I can. And I do believe what Mr. Branna said, Dr. Branna said earlier, is that a lot of the organizations, or maybe it was Mr. Rodriguez, but a lot of the organizations that are getting funding or supporting young people in the communities are doing it because of what they've experienced and what they know will help. I look at the Nation of Islam. I'm just going to say that quickly. I was talking to a group of guys the other day with the Nation, and they told me, they don't get any money from the government to do their programs, but they've stopped violence in certain communities. They just know how to relate. So I think, we're looking at our kids and these ones that are involved in this gun violence like they're little specimens in a petri dish, and studying them, but not doing enough to stop the violence. And my sons and I talk about this all the time.
Publisher Mars, I want to follow up with a question and then open the same question up to the entire panel. As a Black publisher, what role do you see the media playing in being an obstacle to finding these solutions? I think, certainly we at the Amsterdam News are thinking very deeply about how we can change how we report on gun violence, but we have, mainstream media promoting a very particular kind of narrative around gun violence. So I'd love to hear your perspective on this, and then the rest of the panel as well.
Well, I think it's a challenge for us. I mean, if there's anything that's good about being, the kind of press that we are, one, we don't come out as newspapers frequently enough to cover all the gun violence. So, it doesn't behoove us to really cover the crimes itself, but really to take time to look at the issues and what the community is doing to address the crime. Anytime the violence, anytime something happens in a neighborhood, you can always get that quote from that person who's going to say, somebody needs to do something about this. So having said that, we need to find that somebody, that's what we're writing about, and who's doing that something, and figure out how it's working, if it's a solution, and then what we can do as media to promote that as a solution as widely as possible. And I'm learning more the importance of collaboration. Our kids don't listen to radio anymore. They're all on social media, right? So we have to find those influencers in our community that we can help to promote them if they're promoting the kind of messages that we hope that we think will make a difference. But it's just, we have to continue, I think, like I said, look at who that somebody is that's doing that something, and make those the headlines of our stories, as opposed to who the victims, and telling the stories of, a lot of times, we hear folks that'll go out and say, such and such family was killed, the mother. We don't follow up on those stories. What were what was the reaction? What are the consequences of that reaction? Is that person now in a wheelchair for the rest of their lives? Like Dr. Brannis was saying, who the health professionals are, what happens on a Friday night in the hospital, who the heroes are that are trying to keep a person alive. I think there's so many stories we can tell without just focusing on the victim and the crime itself.
Are the panelists want to jump in on this question? I'm sure you guys have some very studied and thoughtful perspectives.
Well, I'll just add quickly that I think the media really needs to stop, like in other areas of our society, how they portray people of color, how they portray white communities, and being cognizant of kind of the different way that we're portrayed in terms of, especially when it comes to gun violence, right? A mass shooting, I remind people, when there's a mass shooting, systems do everything they're supposed to do. You see all the right things. You see all the humanity. You see the caring. You see the money. You see everything. You see what's supposed to happen in society. Why aren't we seeing that when somebody gets shot on the brown or black side of communities? And the media feeds into that. And these are the things that I think we need to really talk about, so that the media itself is aware, just like other sectors of this country need to be aware that the way they're creating narratives about our communities and our own victimization and our own pain varies considerably.
You know, and I would add to that, that in one hand, we need the media because we need to get our story out. We need to make people aware of the work that we're doing so that people can come to you for your services, right? And then on the other hand, you need the humanization of the victim, right? A lot of times, the victims in our community are criminalized and not humanized, and so you need the media to humanize what is happening, because we did not create the environment in which we live in, right? And so when you talk about the impact of the war on drugs, excuse me, the impact of policing in our community, you get a terrorized community. And so when the police come, most of the young people run. Police from another area will look at that as you did something wrong. But a young Black or Latino man doesn't want to go to jail that night, because they know just because of who they are, they could end up in jail. And so all the stories need to be told. And you know, as I started with, the imbalance of investment is based on racism. A lot of the stories, besides the people who, you know, like the Amsterdam News, who tells our story from a different perspective, in the Washington Inquirer, they're few and far between, you know, and so we need to impact that system to help us tell our story in a better way, or help build our own media to help tell our story in a better way. But right now, as Coco said, it's not happening.
Can I add to that?
Absolutely.
Yeah, so let me just say, I think this issue that Kuko raised about mass shootings taking up all the air in the room. Listen, these are absolute tragedies, of course, but they are the tip of a much larger iceberg of shootings in the United States. And I think that has not, that in and of itself, that those are driving the vast majority of media attention, not the overwhelming number of everyday shootings that are not mass shootings. Someone needs to write that story if it hasn't been written yet. I'm hearing rumblings about that from a couple news organizations, but that is a really important story that I'd like to see elevated. The other thing I will say, in agreeing with Denise's comment very much, I think we do need to tell the stories of those involved in these tragic events, but we need to tell the stories of real solutions. You know, I teach class on gun violence prevention at Columbia, and I've been part of a number of them in other universities around the nation. And we take great care not to simply tell, to document the problem, because the students basically lose hope. And they're the future of finding solutions. So we do take a lot of time to elevate what solutions we think are important that could work. And by the way, many of those solutions have emerged in communities that have put those solutions in place because they're fed up and they had no other choices. It's not like the state of New York or the federal government is going to be the cavalry that's going to save this community. They have had to evolve their own solutions, and many of those are quite successful. We don't hear about those nearly enough.
You know, the other,
Doctor, go ahead.
yeah, I just want to say the other frustration that I have, and I mean, I don't know if the informer is quite equipped. We might need somebody like you, Damaso, to help us out. But you know, it's the source of the guns, right? So I hear a lot of different stories here in DC. We're trying to figure out, how do all these kids get access to these guns? Where are they coming from? So we hear, you know, the guns are coming from Virginia. Okay, so somebody knows the guns are coming from Virginia. Are they going out to get the guns, or the guns just, dropping into my neighborhood? I live in a neighborhood. When I see Virginia tags, I'm always suspect, right? And the other thing, someone said to me the other day, well, the girls now, they're involved. So the girls go out into Virginia and bring the guns back, and now they're into selling the guns in the neighborhood. And I'm like, well, where did you get that from? How do you know that? So there are all these theories about exactly why we have this, this massive number of guns that these kids have so much access to, all these weapons. And I've got to believe that there's an honest and truthful story out there somewhere, right? Which means that our legislators should have some way to handle that, and the police as well, as opposed to focusing on what's going on the corner of such and such and whatever. I mean, yeah, it's like drugs, We always knew that folks were dealing drugs in the neighborhood, but we didn't really deal with the source of the drugs, and we're still not. So, it just makes you feel like this is a problem that won't be solved until we can really get at its root. And its root is for these kids, it's in their homes. If possibly it could be in their homes, I say that. But, for the guns themselves, I don't know what the root is. I don't know what the root is. And it doesn't seem like anybody wants to address it.
And I would just say, Denise, I would just caution us to say the root is in the home, when the home is full of oppression, right? When the home lives in the same community that's lacking the access to resources and quality living, right? When the home is in the community that was terrorized by the police and has the whole family traumatized to go outside, or with a guard up to go outside. And so, they always say pull yourself up by your bootstrap, right? But some people don't have a boot to pull it up, or don't have a strap, and so the imbalance in how we live in our communities across America leads to the understanding that is the racism and oppression that is the root to this problem, because this ain't rocket science. It ain't rocket science, like you said, where the guns are coming from. And that's a byproduct. Who's bringing it into our community is a byproduct to its existence and its in our community, because the intention of people who run our society is to get them guns in the community. And they use us as pawns and cannon fodder in their fight to continue to destroy our communities. And that's what we see every single day. I've been doing this work on the front line for 35 years, and when Professor Charles talks about systems and models that works, I would love to know what are some of those that come out of Columbia, and work with you with the ones that we've created that I know works, in helping to spread that across the nation.
Well, I appreciate your words of caution, and I take those to heart, and I agree with you. It's just the fact that from the time I was born, and the time my father was born, and the time my grandfather was born, and my great-grandfather was either born or brought here, we've always dealt with racism. It is here. I don't think it's ever going away. I do believe, and the only thing I can control is what happens in my household, and unless a police officer comes in uninvited, which has happened once, but I can control what happens in my household with my kids, right? I can't control what happens in the street, but I can control what happens in my household. And so if we can get to the point where I'm in control of my house and my kids, that's all I'm saying, because the racism is always going to be there. And I understand its influence and its impact, but that's what I got to fight.
Right. But we got to agree.
Oh, yeah.
1,050% that the days and times of your grandparents and your parents and even us is way different than right now. And the parents, they don't, just the understanding and the mindset that we're talking about that's needed to control your household doesn't exist in a lot of households.
I get it.
I want to just jump in here and ask one final question from the audience as our time is diminishing. We've been calling gun violence a public health crisis, and really smart and well-respected people like Dr. Branas has been doing this for some time, but it hasn't resulted in the investments into our public health system, in the shift from focusing on policing to focus on public health and creating community networks and investing in community organizations like the one that Erica Ford runs. How do we change this? What can we do, whatever position we hold in society, whether it's media, whether it's public health, whether it's philanthropy, what can we do to change this?
So I must say, let's give ourselves some credit because we did change it, right? We did get Biden and the CDC and this government this year and last year to invest in the public health model, to invest both in the CDC, in research and development, and invest in a pilot that they ran across the nation in several different cities to invest in those frontline organizations across the nation. And so the continuation of, talking to politicians and having these kind of conversations more and more often, and Dr. Charles bringing people like me in his classroom and us working together with his students, and the Washington Inquirer holding forums and stirring up the community conversation that impacts public opinion, that impacts government and the decisions that they make, that puts people in office as well who are in alignment with what it is that we're doing. Like we saw Max Forster, the youngest congressman elected into office, Gabby Gifford's husband, and different people like across the nation who have come from the gun violence movement and are now elected officials, right? And so they take part in helping us push those marathon run across the finish line. But we are moving in the right direction and have garnished a lot of success.
That's a great point, Erica. It's always important to us to recognize that progress we've made. Mr. Rodriguez, do you have something to add?
Yeah, but I also want to go, because it's related. I want to go back to the previous conversation around guns, because I think it's important, because that's part of what we're kind of being tasked to look at. And I agree that racism has been here forever, but it's been untreated. The internalization and the evolution of it, and the trauma that exists over 500 years of generational trauma that people have. We no longer have to worry about the Klan coming in and lynching us or hurting us. We're doing it to ourselves because it's been so internalized and unaddressed and untreated that now all you have to do is traffic guns into our communities, and we will do it for you. We'll kill each other. And I think that that's an important thing. So while we need to focus on stopping and the negligence of law enforcement of stopping the trafficking of guns into our communities, because I'll assure you, if I was trafficking guns into white communities for white youth, it wouldn't be very long before somebody stopped me. And so it becomes a big business to try to address the people that have guns versus who's trafficking guns into our communities. And I think it's an important thing to consider. The other aspect of this, I think more to your point, that speaks to the public health issue, but it also speaks to the challenge that we face, which is even if you remove all guns from all communities, it does not change the conditions that create a mindset for people to believe that the way to solve an issue or solve conflict is to take my own life or to take the life of others. That's a deeper issue. That's a spiritual problem. That's a heart problem. That's something that we have to work at, where it goes beyond just public health. It really speaks to the internalization of racism and 500 years of oppression of this country. And I think that we really need to talk about that work, because that work is a lot harder. While we need to decrease access and pass legislation that works for our communities as well as it's worked for white communities, because we've been successful in that area, we also need to look at how to address that, not just public health issue, but going beyond that, because it's really a bigger dilemma that this country has been wrestling with, which is since it began, which is a false hierarchy of human value where darker lives are valued less.
That's a really profound point you make, and one that we should definitely spend some time considering. Dr. Pranas, did you want to add anything to this particular question?
I think there are on-the-ground opportunities that directly address the decades of disinvestment in Black and Brown communities. And again, these are not about law enforcement. These are about giving things back to those communities that government and private agencies can do, things like jobs creation. I always talk about Operation Peacemaker in Richmond, California, and other sorts of programs that took kids in the community, and instead of criminalizing them and pointing the finger at those kids, it gave them stipends, it gave them supports, it gave them trips to, who knows, to various places around the nation so that they could have all these sorts of things. And that, along with other structures that I think have been just disregarded for decades and decades, things like vacant and abandoned spaces and places in communities. We've done a lot of work on this particular topic in cities around the nation. And when you change those at the request of the communities, by the way, that changes people's, that very context that people experience every day in their communities, making parks, improving housing, introducing lighting, and introducing jobs into those communities. Those are real opportunities that I know it seems as if they're disconnected to gun violence, but we now have really amazing evidence that those knock gun violence down by a significant amount and keep it down for years and years to come. Not temporary reactive solutions. We really do need to think about that in the context of historically marginalized communities over decades and decades that have been put in this bad position, in this negative context.
You and the other panelists in your answers have been talking about something which I think is really important for us to highlight in our last 2 or 3 minutes here, which is gun violence is not an isolated problem, right? It has many roots and it manifests itself in different ways, and it intersects with other problems in our society. And just as we end, I'd like us to just, if each panelist could who's interested, could just talk for a minute or 90 seconds about how we need to start thinking of moving away from this ideology of isolation when we talk about gun violence, as if it's its own problem by itself, but really how it's a manifestation of the other ills and other problems that plague our society and especially impact Black and Brown communities.
Damaso, if I can jump in really quickly, because this is Black History Month, and it takes me straight to the quotes of Dr. Carter G. Woodson, who really he created Black History Month so that we would have the tools and the equipment to deal with times like this. And one of his statements, and this is like the early 1900s now. In one, he says, the oppressor has always indoctrinated the weak with his interpretation of the crimes of the strong. Something to think about. When you control a man's thinking, you do not have to worry about his actions. And lastly, and I'm going to change the word, but if the Negro in the ghetto must eternally be fed by the hand that pushes him into the ghetto, he will never become strong enough to get out of the ghetto. So, I just happened to come across those quotes. To me, they hold true. And I think while we're all out here trying to find solutions, my daddy used to say, if it is to be, it's up to me, and no one can save us for us but us. And so I'll end there with regards to my statements.
Thank you. Does anyone else want to jump in our last 2 minutes?
Definitely. As we address the disease of violence from the public health perspective in New York, we have a system that at its base deals with the intervention and prevention side of the actual person with the gun. And then, as Dr. Charles was saying, all of those wraparound support services that can help people heal and transform from the generational trauma of violence and oppression and racism in our community, and then get some access to job, get some access to educational training, get some access to mentorship and all of the various things that you need in your community to breathe life into you. I believe in self-determination. I believe in the power of our people, but I am understanding of the reality of the oppression that we live in. And when you, like for me right now, you heard me coughing, I'm sick. But I can't even control how I heal myself because nobody could tell me what's wrong with me. I don't know how I got it, and I can't help myself feel better. And so for me to say I could go do da 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 da. I can't because I don't even know what's wrong with me. And I've gone to hundreds of hospitals and doctors, right? And it is because of the lack of quality food, quality oxygen. We can't even breathe, much less read, because our schools don't teach us. So if we could create a way where we could transform our communities and really control them and really have self-determination, where we can determine what we need. Right? We don't need outsiders to tell us what we need, to tell us how to do and heal ourselves and stop gun violence. We just need the resources and access to them. And then we can transform our lives, our homes, our communities, and give our children a real ability to acquire freedom in this world. You know, a real ability for equity and not just the theorizing of it.
Yeah, powerful words. I want to thank our panelists, Ms. Ford, Ms. Barnes, Dr. Branas, and Mr. Rodriguez. I wish we could continue this conversation, but we have another panel coming up directly after this. But I encourage everyone on this call to continue the conversation on social media and reach out to our panelists and let's find ways that we can continue to work together, because this is a marathon. It's definitely not a sprint.
Yes.
But I'm really glad we're able to have this convening and have you and bring you together. And we look forward to including you in all of you in your work in our future convenings and hopefully in our future reporting as well. So thank you very much.
Yes. Thank you for having me. Thank you for always being there.
It's nice meeting everybody.
Thank you, guys. So we are going to flow seamlessly and only 1 minute behind into our next panel, our third panel of 4 for this convening. And for the next 40 minutes, we're going to be exploring solutions that are working to end the public health crisis of gun violence in Black and Brown communities. And we spent some time earlier today talking about the root causes, talking about some of the challenges. Part of our goal in the work we're doing with Beyond the Barrel of the Gun is to highlight solutions, because unfortunately, too many of us think of gun violence in Black and Brown communities as something that is endemic, something that we cannot get rid of. And we know that to be untrue. And so that's why we want to focus on some solutions as well. And that's also what we're going to be doing in the reporting that we're doing. So for those of you who are just joining us, my name is Damaso Reyes. I'm the investigative editor for Blacklight, the Amsterdam News' investigative unit. And I want to introduce our panelists as well. If you were here earlier, you got to hear from Publisher Tatum, the publisher and editor-in-chief of the Amsterdam News, which is widely regarded as one of the most influential of America's oldest continuously published Black newspaper. She was instrumental in the creation of Word in Black, which is a historic partnership of 10 legacy Black newspapers, which are banding together to combat racial inequity. Eleanor's passion to finding solutions to the public health crisis of gun violence in Black and Brown community is really the fuel behind the creation of the Beyond the Barrel of the Gun initiative and today's convening. We are also very fortunate to be joined by David Banks, who is the Chancellor of the New York City Department of Education, which is the largest school system in the nation. He is the former president and CEO of the Eagle Academy Foundation and the founding principal of the Eagle Academy for Young Men, the first school in a network of innovative all-boys public schools in New York City and Newark, New Jersey. We're also very fortunate to be joined by Jim Brady, who's a vice president at the Knight Foundation. And he is a digital media innovator whose experience ranges from leading major news organizations like the Washington Post and WashingtonPost.com and Digital First Media to starting a company that built local news sites in 3 cities. And last but certainly not least, Danielle Sered has envisioned, launched, and directs Common Justice. She leads the project's efforts locally and nationally to develop and advance practical and groundbreaking solutions to violence that advance racial equity, meets the needs of those who have been harmed and does not rely on incarceration. So thank you all for being here. I'm looking forward to a very rich conversation. I want to start first with Eleanor. You've been the publisher of the Amsterdam News for a very long time. I'm probably one of the few people who might know you before you were publisher, but I've been benefited from your largesse as publisher. Can you talk a little bit about the positive role that media can play to solve gun violence in Black and Brown communities? We spent some time talking about how the media can be an obstacle, but let's focus on how media can actually help solve this issue.
Well, thank you so much, Damaso, for being one of the moderators today. Really appreciate it. And thank you all the other panelists for joining us today. You know, one of the ways that media can be a positive part of the solution is by telling some of the stories that are helping make a difference. And those are the stories that are talking about people and organizations that are changing the paradigm. Places like Life Camp, like Erica Ford, people like Jackie Rowe Adams and Harlem Mothers Save, people that are on the ground making change that is affecting the lives of those that are affected by gun violence, and really getting to the heart of the issues. And by telling those stories, by telling them over and over again, by getting to every facet of them, we are able to show the root causes of gun violence and hopefully direct other people, especially those that can fund change, the information that they need to be able to put together legislation and funding for that, so that money can be directed to the right place. And that's one of the things that we're hoping to do with this whole initiative, is to give people the information that they can use to be able to change the whole way that gun violence is looked at and funded, to to bring an end to gun violence.
Chancellor Banks, I wanted to talk to you because you are the head of the nation's largest public school system, a system which is majority minority in terms of serving students. What's the role that education can play, and how can we shift this conversation towards the proactive role that education can play in preventing gun violence? And how do you incorporate that into the work you're doing as our new chancellor?
Yeah, so thank you so much, first of all, and Eleanor, thank you so much. It's so good to see you. Thank you for inviting me to even join you here today, as well as the other distinguished members of this particular panel. I had a chance to listen a little bit earlier, and I heard my good friend Erica Ford breaking this stuff down as only Erica really can, with passion, with an intensity and a sense of urgency that is critically important. I think that the education of our young people is absolutely critical to how you solve issues of gun violence, community violence, and so many other issues. Really at the core of it is around how we're educating our young people. And so, so I think you're absolutely right. We've got to center that, right? So I kind of have what I consider a couple of short-term strategies and some long-term strategies, because the kids are shooting right now. That's happening. And so I can't be so caught up in the long term that I'm missing the moment right now of how to help to get our kids to stop shooting and killing each other. So one of the things that we've engaged with here in our schools is the creation of something that we call Project Pivot. Now, Project Pivot is well over 140 some odd community-based organizations that we have contracted with to put these folks into the game. These are organizations that have been out here who love our communities. They come from our communities. They come from the very neighborhoods where a lot of these issues of violence are actually happening. And they are, in fact, credible messengers and folks who have a track record of doing good work. Many of them have been doing this good work over the years and have not received any funding at all. And so we put up $9 million toward this initiative, just as to set it as a baseline to get us out of the gate. And it will require many more dollars than that. And we are actually right now engaged in a process to actually put even more dollars on the ground right now to help with this. So I think, first of all, the whole notion of how the village must raise the child, that's what Project Pivot is. And so I'm proud of that work. It comes from my own experience having worked with Eagle Academies before I came here as chancellor. And I understand that we cannot police our way out of these issues, nor should we. The police have a role to play, and the community has a role to play. And so Project Pivot is a very serious focus on a role for the community to provide a level of mentorship, teaching kids about our history, and just being folks from the community who really care deeply about what's happening with young people. Because that's the biggest key for so many young people who might otherwise find themselves engaged in negative behavior. They have to know that there are people in their lives who care deeply about them, not in passing, but deeply. And even if it's just one person, a young person will transform their own behavior. Sometimes even if it's not for themselves, they'll do it for that one person. I'm going to do it for you. I'm going to stay on the right path because I so appreciate that you care about me that much. That's really important. A couple other things that we are doing. We put additional school safety agents in our schools. The numbers dropped significantly during the pandemic, and we've got it on the uptick now. I feel really good about that. Some people may or may not know, I started my career as a school safety agent, working in our schools. And so I'm very sensitive to when people talk about school safety agents as almost like we're policing schools. That's not the case. School safety agents at most schools around the city are every bit as part of the fabric of success for that school as Miss Kennedy, the 8th grade teacher, or Mr. Williams, the 3rd grade teacher. They are part of the fabric of the school, and kids grow to count on them just as well as they might count on anybody else. So those things are really important. Last point I'll leave you with is this. We've been working together with the mayor very closely with NYPD because we don't discount them, particularly in the short-term strategy, where we've got to make sure we're doing everything we can to stop these kids from hurting each other. We've created these safety zones and these neighborhood zones. So right at dismissal and right at the entry point of our schools, opening and closing, that we've got these NYPD together with parents, community folks, all coming out to be a presence in our community and in and around those schools. A lot of the issues that you see that jump off after school happens, if there were just more adults outside, the kids would go on about their business and head home, and you wouldn't even have the issue. So we've got to invoke the village to do more than talk on the sidelines, but to actually get involved and get engaged. And that's what we're trying to do.
Thank you. Danielle, can you talk a little bit about, in your experience, from your perspective, what's the biggest game changer that you've encountered to preventing gun violence that maybe the rest of us aren't aware of? Because that's part of what we want to try to do here, is highlight these quote unquote hidden solutions that aren't hidden necessarily from people like you who are doing the very hard work in the community.
Thank you so much. And it's just an honor to be here with all of you. I mean, I think from my perspective, the biggest game changer is understanding that enforcement is not what reduces gun violence. And this is, we've heard this from the other panelists already, and I appreciate it a great deal. Like, gun violence is reduced in relationship with caring elders, caring neighbors, with one another. We experience greatest safety in relationship with people. Violence is reduced in healing. And if you had Erica Ford here earlier, I am sure you heard of that. Like, there is no greater intervention to upend gun violence apart from, over time, what you have to do is you have to upend the structural inequities that drive violence in the first place, right? The distribution of resources that position some people to have fewer options to live their lives peacefully than others. And in the nearer term, you have to heal harm when it happens, right? You have to understand there is nobody who has shot a gun who hasn't been a victim of violence, who hasn't lost loved ones to violence, who hasn't witnessed more gun violence than anyone ever should in their lives. And so in mending and healing that pain is an essential element of it. And then we know that we can't enforce our way out of it. We cannot police our way out of it. So at Common Justice, for example, we run an alternative to incarceration for serious and violent felonies based in restorative justice, where with the consent of a prosecutor and of the victim of the crime, people come together and reach agreements about how they can make things as right as possible in cases of serious harm. Fewer than 7% of our participants have been terminated for new crimes on our watch. And of the people who graduated in the decade since 2012, only one has been convicted of a new violent felony. And even that was only a possession charge. And so we know what to do. We know that holding people meaningfully accountable for harm that they cause, while at the same time supporting them in transforming that behavior, can upend the cycles that otherwise persist. And we know from the other part of our work that walking steadily with people, with survivors of violence and crime through their healing and the transformation of their pain is essential to ensure that they get what they inherently deserve as survivors, and also that they don't pass that pain on to others.
Restorative justice is definitely something I think we should spend some time talking about. But I also wanted to talk about and broaden the discussion out, and this is open to the entire panel, is how do we change our mindset if what we're seeing so much in our media, so much in our social media, is this concept, if it bleeds, it leads, right? Going back to the previous panel talking about our sad obsession on mass shootings. The truth is, the vast majority of gun violence doesn't happen in mass shootings. It happens individually. It happens through handguns. But the press, social media algorithms, it highlights these large-scale tragic events, and then we disappear. We don't hear what happened to the community afterwards. We don't hear what happened to the perpetrator or the victim, largely, unless there's a court case. How does that affect our conversation, and how can we change that? That's open to the panel.
I mean, I think it's pretty, I mean, this has been a longstanding problem for media, maybe a little bit more broadcast than print. But I think, that you mentioned the phrase, if it bleeds, it leads. And that was a driving force for local television for a long time. They need pictures. Sirens and police tape is a better picture than nothing. So a fire is a better picture than nothing. So you tend to get driven to the things where there's a lot of action, and that action tends to be negative action. And one of the things that before I took this job, I did a lot of consulting for local television and pushed them very aggressively toward the idea that maybe that works on television. I don't have a long history in broadcast, but maybe if it bleeds, it leads works in television, maybe covering extraordinary things that happen, like shootings and fires, and maybe that's the right thing to do. But on the internet, you better do the ordinary well, and you better tell people how they're going to solve problems and not just tell them of the problems, because people don't wake up looking, nobody wants to wake up and read a newsletter spit out by their local television station that tells them everybody who died since they went to bed. They want to know how you're going to fix the problems. And I think you're starting to see now a little bit more of a move toward the broad solutions journalism model, which has been a big thing for the last 10 years in journalism, of like really focusing on what we're doing to solve problems rather than just always talking about the problem. And one of the things a lot of my fellow journalists like to say was that, all journalism has always been solutions journalism focused. I think that's garbage, because if you look at a lot of stories in a lot of newspapers that talk about someone who was shot, somebody who was arrested, there's no solution in there. You're just talking about the bad thing that happened, who died, and who got arrested. There's nothing in there that's going to help solve that problem. So what you're seeing a lot more of now is you see the Trace out there covering gun violence. You see even the TV stations I work with now do a lot of work focusing on, the Orlando TV station I work with just did a long series on red flag laws in Florida and are they effective? And another station in Detroit wrote about gun violence in schools and what can be done. So they're focusing on actual tactics that are being implemented in school systems to try to see if they're working, and if so, can those solutions be exported to other markets. So I do think you're seeing a shift. I don't think you're going to see it happen overnight, but clearly it had to change, because I do think local television and to some extent newspapers, when they were a lot better staffed, did focus on police blotter things. And that gave this impression that the only things that happened in a lot of parts of a lot of cities were bad things. And it just was not true.
If I can, I would just say, Jim, I'm heartened to hear that from you, because I tell you, you look at a lot of the mainstream media. I mean, it is just so depressing. I don't look to the media to create solutions, to lean into solutions. I've long seen them, by and large, as just creating almost panic amongst the people, and feeding a very negative narrative. I remember several years ago, I was on a panel and they showed a clip in Cabrini Green houses in Chicago. And it was a murder that took place there in the public housing. And they were on the scene, and it was late at night, and they were interviewing a little boy who was about, I don't know, maybe 10 years old. And they said, what do you think about what happened here? And he said, when I get older, I'm going to get me a gun. And it created a visceral response from the people in the audience and the TV audience, as anybody would hear that and say, boy. And in fact, the folks on the anchoring who were anchoring it that night said, you know, almost like, wow, the cycle continues, right? But here's the thing, what happened. That's not what that young man said. He said that, but he said something more. He said, when I get older, I'm going to get me a gun, because I want to become a police officer who's going to stop the bad people from hurting the good people in my community. That's what he said. That was the full text of what he said. Somebody made a decision to cut that off, right? And only play the piece of it that created in the consciousness of people another young Black man to be feared. He's a little boy, but he's going to get older, and you better fear him as well. See, so that's what I mean, those editorial decisions that are made to create that type of narrative. I still see those things continue to play out. So I'm very happy to hear what Jim is saying in terms of that things are starting to change in certain places, and certainly hope so. I've never looked to the media to help us to figure out how our way out of this. I think we need to continue to hold them to account. I think that the places like, Amsterdam News and the long history that they have always been about that. We had groups like the Committee to Eliminate Media Offensive to African People, CIMOTAP right here in New York, that for years was really about, flagging all those kinds of issues that were unduly presenting us in a negative fashion. And so I think from a media standpoint, we got to always be on guard. I know that I certainly am. And but at the end of the day, media or no media, it's still ultimately about what do we do as a people and as a community to try to make sure that we are taking care of ourselves and taking care of all of the people within our community.
Yeah, if I could just jump in one more second. I was going to say one more, 30 seconds, I promise. The reason that change is happening, I think, is because the business model of journalism is changing. And it used to be based on advertising, which meant, what can I get the most page views on? And it often was tragedy and terrible things happening. And nowadays, you're looking at a model that's shifting to where people are raising money from readers, and readers don't want that. Readers want to know what's going to make their life better. And they don't care how many page views something gets. They want to know if this has intrinsic value to their life. And if it does, they're willing to pay. Maybe not a ton, but enough that if enough people do that, it can sustain that business. So I think the incentive of what media is doing is changing. You're absolutely right. And there are still places that are going to do exactly what you're talking about, that are going to gin up controversy, because that's where they think they'll get the audience from, because they're still largely based in an advertising model and an audience model. And I think you're seeing that change at a lot, with most local media now is moving to more of readers paying the freight, which I do think comes with its own set of challenges, but generally moves you in the direction of trying to produce work that actually has value to community.
That's great. Very glad to hear that.
And I would
And
echo
Jim-
all of that about the shift to solutions journalism, and also say, even in the sort of transitional period when we're telling stories about shootings, about murders, about all of that, there are choices that journalists can make about their sources. Going only to the police to report on a story about a shooting is just lazy journalism. It's easy to get. You can get an arrest report, you get whatever, enough to fill out the story, you read it everywhere. The story everywhere is the same because it comes from the same 4 lines of information. But they don't call Erica forward and say, Erica, why do you think this shooting happened and what could have prevented it? Erica, what do we do next, right? They don't call community leaders to say, what have you been asking for and not getting? Who have you been asking? Say their names. There's all sorts of ways you can generate feelings of controversy and conflict by actually revealing like the decision makers that stand in the way of advancing the structural reforms that community members have long known would prevent violence. When community members talk about education, when they talk about parks, they are talking about violence. But we say it as though and then people say community never talks about violence. That's because community members are talking about the things they know would prevent it. You can name those things. You can uplift the perspective of crime survivors and stop with the very similarly lazy move of presuming that police and prosecutors are always the rightful spokespeople for crime survivors. There are times that their interests are aligned and there are times that there are not. And I think it's really important when we think of the constituencies whose perspectives gets raised in the telling of the stories, that we develop a discipline of understanding survivors as a separate and different constituency from police and prosecutors so that they can speak in their own voice, they can tell their own truth, they can speak to their own pain, and they can speak to what they know would have prevented it and would prevent it in the future. And those are options journalists have, even as they're still writing stories with gory headlines.
And Danielle, that's part of the reason why we are creating Beyond the Barrel of the Gun. So we can tell those stories and we can talk about those solutions that are working, those things that are changing the paradigm, those things that are really making a difference. And beyond that, what we also need to be talking about are the places where the systems are falling down, where, unfortunately, David, where education is falling down, but where it also is succeeding in making the changes that need to be made, where mental health is not working and where it is working. We've got to talk about the successes, but we also have to talk about the failures and how those failures can be fixed. And those are the stories that need to be told so that we can figure out how to change them or how to amplify them so that they can help the largest amount of people possibly, and also be replicated in other places so that we can help make change in greater areas. So, I mean, everything that everyone has said is so true. We just have to figure out how to make the things that work happen in more places, and the things that don't work, throw those to the wayside and change the way some media is covering things and make other media do it well more.
Publisher Tatum, I wanted to follow up because, you know, for 3 decades you've led a small community-based news organization. You helped create the Vision and Found Word in Black, which brings together 10 other legacy news organizations. How do you have conversations in your newsroom with experienced editors, with experienced or new journalists who are used to covering gun violence a certain way, with your fellow publishers who, you know, for better or worse, somebody gets shot, we do a story on it, and then we move on and somebody gets shot the next week, we do another story on it. How do you as a newsroom leader talk to your fellow publishers, but also talk to your staff about how and why we need to change the way that we cover gun violence in our communities?
Why is it still happening? What isn't changing? I mean, because we keep on seeing them throw money at the police, and we know that that just is not working. So what do we have to be doing as journalists to help shed light on what could possibly work? What do we see that is working, and how do we tell those stories? And that's what we have to be looking for. And that's what I keep on saying to our newsrooms. All right, let's write the stories that matter. Let's talk about those people that are still here. We have to talk to the families. We have to talk to the survivors. We need to talk to the people that still can make a difference and that can continue to make a difference. And we need to find out what these solutions are. And again, that's why we started, you know, Beyond the Barrel of the Gun to begin with. And that's why, you know, when we had this opportunity to start a discussion on what we were going to be focusing on, that we said gun violence. And again, it's, yes, there are mass shootings that are perpetrated by one person, but there are mass shootings in our community all the time. They may only be one shooting at a time, but in a weekend, you'll have 11 or 28, people that are gunned down in separate incidences. But to me, that's a mass shooting, even though it may happen in 28 different locations, but it's all in a community. And when I say a community, I mean that's a community of New York City or in Chicago or somewhere else. But it still affects the communities, their common thought, their common livelihoods, because it's on everyone's mind. And when you see a headline that says, 28 shootings in 48 hours, you think to yourself, what is this world coming to? And it's not like you have the same sort of resources that are put into it when there is a mass shooting somewhere and everyone comes to the rescue to help those families, because we're talking about 28 or more families that are victims, and they're in 28 different places. There's no one central place, and you may not even know their names. You may not even know all those victims' names. There's no mass story about those shootings. There's no focus on them the way there is when there is a mass shooting somewhere. Usually because it's happening in Black and brown communities. And it's a very different reality when it's happening in Black and brown communities. And the focus is very different of media in general when it's in a Black and brown community. And so the story is told in many times differently. And it's told from that place that Chancellor Banks was talking about, where only part of the quote is given and not the whole quote, because they're trying to editorialize it in a very different way. So there were a lot of different issues going on.
I want to pose a question to the panel. Anyone can jump in here. We've talked about trying to change the media narrative. How do we change the funding narrative, whether we're talking about government, whether we're talking about private philanthropy, to get them to focus on the things that work rather on the things that are easy, right? Because there can be a little bit of a distinction there, or the things that are popular, right? Almost no political leader is going to lose an election calling for more cops. But how do we get that political leader? How do we get ahead of a foundation to say, let's fund journalism that focuses on beyond covering what's bleeding, but how to solve things? How does a nonprofit director convince a government or a philanthropic leader to fund a program that has such great results like yours, Danielle, but is not as high profile as a cop walking a beat? And anyone can jump in here.
Sorry, I was muted. I certainly think it's by a lot of philanthropy. I think it's by focusing on the core area. I mean, there's so many ways into this problem. Almost no matter what you fund, there's a way to help with gun violence. I think from the media perspective, we were the largest funder of an organization called the Solutions Journalism Network, which is doing this kind of work all around the country. And they do, the kind of work they do is they did something earlier or late in 21, early 22, I can't remember, about a Denver program that was a police department group that was created specifically to focus on non-fatal shootings. And in a year, they took the case solved. They went from solving 25% of the cases to 67% of the cases because they dedicated a group to focusing on this very particular kind of gun violence. And you can go down the list of, there was a study done in Philadelphia about how foot patrols a certain way of doing foot patrols reduced crime in certain parts of Philadelphia where doing it other ways didn't. And the idea is then to take those issues and those solutions and get them out into the wider world so that other departments can try to replicate what's working and what's not. So I think whatever it is you fund, I think the key is just looking for a pathway to helping solve this problem. If you fund education, this is a problem that impacts education. If you fund racial equity, this is obviously something that impacts that. So in our case, since we fund journalism so focused, that is our focus as part of this problem, is just trying to fund the kind of journalism that actually helps solve these problems rather than just hammer on the fact that shootings keep happening, as opposed to ever suggesting how maybe we might reduce the number of shootings dramatically with actual tactics on the ground.
You are funders, philanthropists want to fund things that they think work and have the potential to work. Nobody wants to see their dollars going toward things that are just short term. It's not going to work. It's like you're throwing your money away. You want to feel like you're part of a success story. That's really important. So you need the right champions and you need the right evidence and you need the credible messengers. Because sometimes if you're a trailblazer, you don't have all the answers up front, but people believe that they can invest in you as an individual because you're somebody that has a track record of success. Folks will do that, but they got to know about who you are as well. That's part of the reason I say you need champions sometimes as well, to introduce you to the right people, and so that you can hear their story. I always recall how Jeff Cannon and all the great work that he was doing up in Harlem for 20 years almost before he met Stanley Druckenmiller, who helped to finance the Harlem Children's Zone and expand and scale his work. But you need a champion for that, and you need to be doing good work that people can in fact rally around. So those are a couple of things I think that you've got to be mindful of. But the issues, and maybe we'll get to this, are much deeper than all of this, and how the media is ultimately telling a story. But the challenge here, Damaso, is much more significant than the media. It's much more significant than even community groups that are trying to quell the violence. The issues are much more systemic than even that. And I will tell you, as somebody who's been sitting in this seat for a year as schools chancellor, it's a very fundamental issue that I see. Our school system has been deeply, deeply flawed for decades. And what I mean by that is this: 65% of Black and brown children never achieve reading proficiency in a school system that has a $38 billion annual budget. You just think about that. With all of those dollars, our number one mission should have been to ensure that at the very least, everybody's going to learn to read on grade level. We don't even do that. We take our kids through a system of schooling. When I was in school, and growing up in Crown Heights in Brooklyn, that was not a wealthy community, but everybody learned to read. There was a time when the New York City school system ensured that everybody was going to read well, or at least on grade level. And over the last 25 to 30 years, we got away from that. We shifted from this phonetic approach to the teaching of reading to this what's called whole language, balanced literacy. Progressive nonsense is what it was. And all across the nation, the results are in. It has not worked generally, and it has not worked very specifically for kids of color. Our very fundamental approach to how we teach kids to read. Because when you do the analysis of not of the shooting victims, but of the shooters are kids who've given up on themselves. The shooters are the kids who've engaged in negative behavior because they've gone through a school system that has not honored them, that has not affirmed them, and that has chewed them up and spit them out. And then they get out there, we label them as perps and all the rest of that. These are kids who have the level of brilliance that anybody has. But we put them through a system that has lots of really good people, smart teachers, people who care deeply. The wrong tools, the wrong approach to how we're even engaging kids. I was at Rikers Island a few months ago, and I'm talking to all these young men, and I said to them, how did you wind up here? And they all told me their story individually, but each story had the same commonality. At some point, a disconnection from school. And yet, while they were in Rikers, They were doing carpentry and electrical and HVAC and plumbing and all of this. They were learning a trade. And one young man put his hand up. He said, "Mister, if I was doing stuff like this when I was in school, I would have gone to school every day." But they were in a school experience where it was like, we're just being told by everybody, go to school. And they're like, it was boring. It was, I didn't even know what the point of it was. A lot of our kids who still stay in school are bored to death. So the whole approach to how we have to reimagine a school experience is what I am fully engaged in right now. We got to teach our kids their history. We got to teach them how to read. We got to make school more fun and exciting, a place that they want to be. Because when you get that into their spirit, you don't have to spend time chasing them down about shooting people. Kids who believe in themselves and think that they have a future don't go around shooting people. So we are really, all these conversations really happen on the outskirts of what the fundamental issues really are, Tommaso, and that is we are not doing right by our kids at the earliest ages, and we die, the cast gets died on them very early on, particularly young men of color. That's why I'm here as Chancellor now, and the Mayor Eric Adams, is my goal to try to shift and change and transform the lives of these kids through some very fundamental approaches of how we have them show up in school and ultimately in life.
All right, Chancellor Banks, we're gonna call you, and we're gonna work with you, and we're gonna highlight some of that transformational work that you guys are doing, so that we can lift that up. Danielle, I know that you have something to contribute on this.
So I think, I echo the sense that, philanthropy wants to see things that work. There are ways of communicating with philanthropy that help. And still philanthropy is never going to be at the scale of government resources. And so I really believe the axiom that budgets are moral documents, like that you can tell a place's values by where it puts its money. And I think about us as a city that on the heels of a pandemic, where kids were separated from school environments, suffered huge setbacks in their learning, we make a decision, the Adams administration makes a decision to cut, what, 567 million, is it, for the expansion of 3K programs, which were poised to be universal 3K, right? And we say this, and you get in conversations about gun violence, and they're like, it all starts early, it all starts when they're young, you have to go back to the beginning, and everyone sort of wants to dodge working with people while they've actually caused harm by talking about prevention, but then we will not fund prevention, right? We will not put our money there. And ultimately, I think the thing that changes that is about power, right? It's about how and where citizens, members of the community, New Yorkers, organize around their values, around the solutions they want to see uplifted, and hold elected officials accountable to ensuring that those moral documents actually reflect the values of the people who will live and die based on what that bottom line ends up being. And so it's one of the places where good journalism can help with the part of that is public education, that fosters an understanding not only of what the underlying problems are, but of who has power to change them, right? So there's often a sense that when we talk about systemic problems, it's just amorphous, but it's not, right? There are budgets that determine that, there are policies that determine that, and those budgets and policies can be changed, and they can be changed by people who are accountable to the voters in their districts. And so I think one of the important things is that we connect these realities about grave racial inequities in our city historically in the present, the realities that you're uplifting, Chancellor Banks, about the insufficiencies of our current education systems and the inequities of it, and also connect those with great clarity for people about the pathways toward that change, because it's only in shifting the conditions of power that those changes will be made differently. I think, you're right, Jim Brady, that no politician ever worries about funding more cops, right? That they don't think that's going to cost them anything politically. And changing that political calculus where underfunding solutions and overfunding enforcement becomes bad for people politically, that's when I think we start to see real movement in those resources at the kind of scale that can actually prevent this harm in the first place.
Danielle, I wanted to follow up and circle back to something you had talked about earlier, because I feel like it's a highlight. It's something that's worth being highlighted, which is this idea of restorative justice. And how does, in your experience and how your organization implements it, how does this work to heal the victim, and as well heal the perpetrator and prevent the continuation of gun violence?
So restorative justice is a process where the people most directly impacted by a given harm come together to address what happened, address its impact, and reach agreements about how the responsible person can make things as right as possible. An ancient practice that we now apply as an alternative to incarceration in the system. And part of what transforms the survivors is, as survivors, I say this as a survivor of serious violence myself, the two things we cannot stand the idea of going through it again, and we cannot stand the idea of someone else going through what we went through. And so the survivors that choose to see the people who hurt them in common justice, 90% choose it. And these are survivors who called the police, who went to grand jury, 90% still choose common justice. And they don't mostly do it out of mercy. They do it because they live in neighborhoods where violence and incarceration are common, and they see that that incarceration hasn't produced the safety they deserve. If it did, they would have long been safe. We incarcerate more people in this country than any nation in all of human history. If incarceration worked, we would be the safest nation to ever have existed. And more than that, the Black and brown communities, where most of our incarceration is focused, would be havens, absent where if a kitten got hit by a truck, you'd have to hold a vigil because that kind of loss would be so uncommon. It doesn't work. It doesn't produce the safety people deserve. And survivors know that. And so when they're presented with an option that might work, they choose it. In our process, the people responsible for harm go through a 15-month violence intervention program where they examine their own experience of violence, their values around it, why they use it in their lives, what they think it will and won't produce in terms of safety, and how to transform those behaviors. And we support them in the process of that transformation. They then sit with the people they've hurt and reach agreements about how they'll fix it, agreements that make it right for the victim, that make it right for the community, that transform themselves. And in that accountability, they are restored to their connection with their community, with their families, with themselves, with whatever higher power they believe in, right? They're restored because they've done right. They've made right of what they did wrong. And while we believe the violence they commit is dead wrong, we also believe there are people possessed of human dignity and capable of transformation and making a contribution to the repair of that harm. So in that process, people who have engaged in meaningful repair and being supported in transformation don't hurt people again. And survivors who have been supported in their healing, who have got to ask why me, did you know the impact, how dare you, and gotten to shape the outcome, don't have to pass their pain on to others as a way of just getting it out of their bodies. And so we know restorative justice has long worked, right? The fact that it is not more prevalent is much more about resources than it is about efficacy. And so we know that the processes that work are always going to be ones that center the people whose lives have been affected by the harm that has happened and position those people to be part of the solution to transform it.
Thank you. We have just a few minutes left, but one of the wonderful things about forums like this is we get to bring together people who would otherwise not meet. So is there anything that you would like your fellow panelists to know or anyone in the audience to know that they don't, or that because one of the things that I've encountered as a journalist is that, I go and interview a teacher, a police officer, a healthcare worker, and I ask them questions about what they're doing and what their challenges are. And oftentimes they speak to me as though everyone should know what they know, but they don't, because we have our jobs and we do them. So I want to give this opportunity to each of you to share something that is sort of common knowledge in your field, but maybe would come as a revelation to the other people on the panel or someone else in the audience, so we can begin to share that knowledge and hopefully move forward some solutions and transformations.
Obviously a good question. Get it all thinking. I don't know that this is something people don't know, but it's worth noting that I think if you look at how media is fragmenting right now, I think that actually ends up being a good thing for coverage of a lot of these issues. I think when you had a few large publications in a market and their goal was to amass as much audience as possible, as I noted earlier, they tend to go for the more salacious, the more the stuff that unfortunately for a long time did drive eyeballs. As media is now fragmenting into much smaller chunks where you see a lot of sites with or publications with 3 or 4 people who are really covering a very specific topic, I think you're going to see the coverage of this get better. As I mentioned, the Trace earlier, and there's what's going on in Philadelphia with the Philadelphia Gun Violence Reporting Project, I think it's called. There's a lot of efforts popping up of people to really tackle this problem in a very aggressive, precise way, and with stories written by people who really know the subject. The other dirty little secret of a lot of journalism in the last 15 years is as newsrooms have gotten smaller, journalists have been asked to know a lot about a lot of things, and the end result of that is often not knowing a lot about anything. And I think you're starting to see much more of an evolution of a new media ecosystem where people are really good at a very narrow thing, but that ends up being much better for the people who care about that issue than the old system.
Chancellor Banks, do you have anything? I'm sure you've learned a lot in the past 14 months that even as a school principal, you probably didn't know.
It's an interesting question. You know, I think for me, I would venture to say our families, right? Engaging our families is one. I didn't realize that our families have the level of angst that they feel on a daily basis, and in many ways are giving up on the system. So I think for me, that was something that as I've moved all around New York City, the energy from parents and families, I think, was palpable for me. But I feel good about where we are because I think they've been looking for leadership that is listening, affirmatively listening, and not making just unilateral decisions that you think are one size fits all. This system is far too large to think that you can make a decision that is supposed to be the right fit for everybody. The whole world lives here in New York City. It's just the sheer breadth of the size and the amount of the demographic sway and just the breadth of it is just amazing. So I think that is really important. I think one of the things that for me is a really important that I've spent a lot of time, particularly since I've gotten into this role, is the fact that our teachers are not well versed in what the 21st century economy really looks like. You know, our teachers have worked within the 4 walls of the school. They were smart. They love kids. They came out to be teachers, but they have very little understanding of what it means to work at a place like Google or Microsoft or anywhere in the fintech industry, the business, the world of journalism. I mean, you name it. And all these emerging industries. For far too many of our schools, if you close your eyes, it might as well be, 1924. Schools have not dramatically changed. Every other industry has dramatically changed, but not schools. Schools look very much like they looked 100 years ago, except you may have a smart board in the front of the room. So helping our schools and our teachers to really catch up to this fast-growing industry and this fast-growing economy and this new world that we've stepped into. Our schools are still operating in isolation, 45-minute classes, the bell rings like with factory workers, then you go off to the next thing to learn the next subject. No other industry operates like that. And so that's something that I think has been a real eye-opener for me. We've got a lot of work to do to help to raise the skill level of our teachers if we in fact expect for them to be the ones to usher our young people in to this 21st century economy. We have a lot of work to do in that regard.
Eleanor, do you want to wrap us up? 2 minutes.
Well, it's just a pleasure to be among these wonderful people. And I wanted to bring something up that publisher Larry Lee said earlier today, and I think it goes directly to what Danielle said in Restorative Justice. Hurt people hurt people. And And it also goes to what Chancellor Banks just said. And when hurt people, we all get hurt. And if we start focusing on people that are hurt, and I'm not talking about the people that have been shot, but the people that are also the shooters, and before they become the perpetrators of crime, before they're behind the barrel of the gun. And we start trying to heal people when they're hurt from the beginning. And we start focusing on the things that can help heal people and tell those stories that help heal, that help educate, that work on mental health, that help with the PTSD, the generational trauma in Black and brown communities. When we start telling those stories or continue telling those stories and tell them in a way that will impact the lives of those and help people get the help they need, that's when we will be making systemic change and will be able to make change that will matter and will help reduce gun violence in Black and brown communities.
I want to thank all of our panelists for joining us. It's been a wonderful conversation that could certainly go on for much longer, but I want to hand things over to my colleagues from The Trace, who are going to be having a really fascinating conversation. I encourage everyone to stay on board. But again, thanks to our panelists, and I look forward to continuing the conversation through the reporting we're going to do. Take care.
Thank you, everyone.
Okay, thanks so much, everyone. Okay, so we are here to talk today about how irresponsible news coverage of gun violence can cause real harm to survivors and their communities, and some solutions we're all working on that will hopefully set a new standard for gun violence reporting that's much more trauma informed. So my name is Jennifer Massia. I'm a senior news writer and founding staffer at The Trace. We are the nation's only newsroom that exclusively covers gun violence. Today, I'm going to be joined by Dr. Jessica Beard, a trauma surgeon and public health researcher at Temple University, who's conducted research into how news coverage that doesn't center the needs of gunshot survivors and their communities can inflict further trauma and actually even endanger people's lives. We also have two of my colleagues from The Trace, Mensa Dean, our Philadelphia-based staff writer, who came to us from the Philadelphia Inquirer, where he was part of a team of reporters named Pulitzer finalists for their sustained coverage of gun violence in that city. And Justin Negrello, our Chicago-based engagement reporter, who's leading our storytelling network in that city, which we are going to hear more about today. First, a little bit about The Trace and what we do. We're a nonprofit news outlet. We launched in 2015. We aren't a daily news outlet, so we have the luxury of not being expected to chase after newly traumatized people. And it is a luxury to not feel like you're exploiting somebody at their most vulnerable moment. We get to take longer with our stories, and we have editors who care less about getting a scoop or a story than about the people who are choosing to share their lives with us. But we watch from a distance, though, as local news reporters parachute into a town where there's been a mass shooting, get their money quotes and film get film of people crying and leave. And then that's the end of the story for them. So we've consciously steered our coverage away from that. First with a series called Shot and Forgotten, which focused on the long road to recovery for gunshot survivors. That road always begins when the news cameras have left. And then with Ricochet, a series about people whose lives have been affected by guns. And now with a local reporting initiative, we're really proud to announce in two cities, Philadelphia and Chicago, that pairs watchdog reporting with community engagement. In each bureau, we've paired a staff writer with an engagement reporter. So one journalist is on the beat and the other has their ear to the ground. That way the community is telling us what the story is rather than the other way around. In Chicago, we've also launched a storytelling network for survivors of gun violence, which will help a group of people tell their own stories. And we're going to publish those stories, and each participant will get a stipend. So this is a project we're really excited about. Before I get to that, though, I'd like to start with Dr. Beard, who, in addition to her work at Temple University, is also Director of Research for the Philadelphia Center for Gun Violence Reporting, which also empowers people affected by gun violence to tell their own stories, and really spearheaded that model of reporting. It's largely because of Dr. Beard and the center that we know how harmful, inaccurate, and insensitive coverage of shootings can be. She and several of her colleagues recently published a study that featured interviews with 26 gunshot patients at Temple's outpatient clinic, and they shared how they felt about making the news. They said they felt demonized, traumatized, and unsafe. The title of the study says it all, Like I'm a Nobody. Dr. Beard, thank you so much for joining us today. It's a real honor. I understand you were motivated to start this research when you started seeing your patients in the news and wondering what it was like for them for these vulnerable moments to be so public. When you started looking into this, what did you find?
Thanks so much for having me, Jennifer. And it's a pleasure to participate in this panel. And I've really enjoyed listening to others earlier in the day. So as you mentioned, I'm a trauma surgeon. I work at Temple University. It's in North Philadelphia. We take care of the largest number of firearm injured people in the state of Pennsylvania. And it's really anguishing. And sometimes I don't get to meet my patients. Sometimes they may have passed away before they come in, or I can't save them. And that actually led me to go to the news to try to learn more about them and learn more about gun violence in our city. And what I found is what I later learned: episodic crime reports that are focused on single shooting episodes, so maybe some basic information about my patients told from the perspective of police, really without the victim's perspective. And that motivated this study, which was basically an interview study asking people in our trauma clinic who've survived firearm injury what their perspectives were on media reporting on their own injuries. And believe it or not, this actually comes up too in the daily care of firearm injured people. I've heard my patients say, wow, I made the news. I wish I wouldn't have made it for something so negative. With this concern about harms to reputation. We've even had, incorrect or inaccurate reporting on the condition of a patient, reports that a patient died when they were in the ICU and very much alive. That can basically, make us have to do a lot of kind of supporting of our patients that's really unnecessary. So what we found when we interviewed our patients is that about half of them reported that they'd seen a news report about their shooting. And that goes with our previous research that about half of people who are shot in Philadelphia make the news. None of them was interviewed by a journalist or even approached by a journalist. So these are people who are having their personal information stated on the news without their narrative. Just a small correction, the kind of main message was this feeling of being dehumanized, not demonized, but dehumanized. And you're right, Jennifer, that the quotation from one of our participants that it made her feel like a nobody really summarizes our findings. People feel dehumanized when they are the subjects of episodic crime reports. When there's graphic or even police imagery or of the scene, they can relive trauma and experience distress related to inaccuracies, especially if they're reported as unstable when they actually are stable. or the number of gunshot wounds can, sort of be very negative. One person described himself in the report about him as being riddled with bullets, and that had this connotation that he was guilty. There were threats to personal safety when specific details were included, harms to reputation. And then several participants actually connected these harmful narratives with the incidents of community firearm violence. This idea that, and we heard this from some other folks in the panels earlier, that you watch this news, you feel hopeless, there's no solutions presented, you're more likely to arm yourself, community firearm violence increases. No one has actually ever studied that connection, the connection between harmful reporting on community firearm violence and the incidence of community firearm violence. That's something that we're looking to investigate. But certainly from the research on reporting on suicide and on mass shootings, we know that harmful reporting on both of those things are directly connected to the incidence of those public health problems.
Wow. You found, this episodic coverage can actually, and this really stuck with me, can actually undermine support for finding public health solutions for gun violence. Can you explain a little bit more how that happens?
Absolutely. So one thing, I'm not a journalist, I'm a public health researcher and I'm a trauma surgeon. So you can take that with that knowledge. But we know from a lot of research in communications that episodic stories result in audiences blaming victims. So stories that focus on events of crime or events of shootings lead audiences to, basically look at the person who's the victim and say, well, what did they do to deserve this? And we know that in contrast, stories that present crime or violence as preventable, present violence as a public health problem, can lead audiences to hold policymakers accountable and can teach or instruct the public on what solutions they should be seeking. I think an important piece also is the narrator. So in an episodic crime report, the narrator are police. And so, the effect of that is certainly we're especially concerned that could result in people asking or only seeing police respond to firearm violence, not seeing all the effective work that community members are doing to prevent firearm violence. And the downstream effect of that is the public asking for more policing and asking for things that aren't going to work and not knowing which policies are going to be effective to prevent firearm violence.
Wow.
So hopefully that answered the question.
Definitely did. Among your conclusions is that, news reports should include victims' voices. Newsrooms should publish fewer one-off stories and start looking at this in a systematic way. What can deadline-intensive newsrooms like the local nightly news, which tends to sensationalize this coverage, I think that and the daily, newspaper have the potential for doing the most harm. If I read your study correctly, what can reporters on the ground do in these environments where editors don't necessarily want the nuanced take on day one? I did hear you mention maybe more humanizing language to start with. Could you expand on that a little bit?
Yeah, so that's a hard question. We don't have all the answers to that question. We are at the Philadelphia Center for Gun Violence Reporting working with our local journalists from TV news and from radio and print to come up with some solutions. We recently had a workshop with folks from our journalists from Philadelphia, along with people with lived experience of firearm violence and scholars to try to answer that question. But I think an important first step is to educate yourself on the practices of trauma-informed journalism. There's a lot of resources. We have some on our website under trauma and care. The DART Center is really sort of the kind of epicenter of this work. And I think that even if the news output is still harmful. I don't think the journalist has to engage in a harmful interaction with a survivor of firearm violence. So engaging in those trauma-informed practices, understanding that someone has been hurt and that your interaction with them and your news story can either add to their injury or it can help in their recovery, and educating yourself, ideally newsroom education. But if you can't get access to that, educating yourself is an important first step.
What's the next phase of your research?
So I think a really important, and the thing that we get asked a lot is, what is the alternative to episodic crime reporting? So that's something that we're exploring, is which narratives are going to be effective and helpful and actually realistic in terms of, telling these stories differently. But I think more and more we're realizing that all the best reporting still may be kind of silenced, and is still sort of a much smaller part of the pie than this harmful reporting, than the harmful episodic crime reporting. We heard from Jim Brady that reporting is looking different, but the fact is that the vast majority of reports on firearm violence on local TV news, according to our research, are episodic crime reports, and they are harming people, according to our research. So the next phase of our work is really seeking to achieve consensus around harmful reporting and the definition of harmful reporting when it comes to community firearm violence, in kind of modeling our work after the work that's been done on guideline development for reporting on suicide. And then once we are able to achieve consensus there, the goal is to then really start to measure harmful reporting, and to provide that feedback to journalists in cities across the country, sort of at kind of scale. Is your reporting more harmful than helpful? We have 7,000 TV news clips in Philadelphia on firearm violence that we're looking at, and we're hoping to kind of expand that type of work to cities across the country. And really, what we hope to measure is this connection between harmful reporting and the incidence of community firearm violence. That comes directly from our patients and from our community. They truly have told us and believe, and I believe, that there is a connection there. It's more complex than perhaps the connections between suicide, harmful reporting on suicide, and harmful reporting on mass shootings, and the incidence of suicide and mass shootings. But I do believe it's there. And I think that understanding which pieces are the most harmful and could be driving community firearm violence incidents is really the next step for our work. And hopefully it will make a difference. Because what I found is there's a real disconnect between, people like me working in the hospital. Really, for me, gun violence is very, very personal, but also I'm doing research on gun violence and writing papers, and journalists. And I think one way that we can connect is to really discuss the results of our research and hope and really try to learn from those and help those to influence practice.
Yeah, one thing we talk about in journalism is impact, and that's definitely not the type of impact most journalists hope to have, is causing harm. So that's Mensa. You were part of a team at the Inquirer that tackled the root causes of gun violence in Philadelphia, centering the people and communities most affected by it. For one story in that series, you wrote about something we rarely hear about, which is why young Black men feel they need to carry guns, in their own words. And you didn't put any judgment on it, like I can only imagine a local news report would have. You let them tell you what the story was. And I was really struck by that. And I was wondering if you could tell us a little bit about how this survivor-centered approach is guiding your work at the Trace and what you're currently working on.
Well, the Trace is a perfect place to do, as you said, community-centered, survivor-centered work, because we do have the luxury of more time to get to know our subject matters and the individuals who we interview. I can go weeks without talking to a police officer or even the communications office at the police department. which is something that would never happen at the Philadelphia Inquirer or a TV station. So, I use police so often as a starting point, or maybe as a, jumping off point. But, the work that I do, even before I got to the Trace, I really like to, like you referenced this piece that I did. I like to get to the heart of the matter of what's going on. And you do that by finding people. It's not always easy. A lot of people don't want to talk about being victims of crime or even living in a community where there's crime. I actually did a story about my community where I live, and my neighbors didn't want to talk, and I had to tell them, I live here too, but we're having problems here. I live out by City Avenue, if anyone's familiar with this part of Philadelphia, which is it's not a bad area, but there was a spate of shootings, and it was really starting to change the community was starting to feel, there were many in the community were starting to feel like it was a tipping point, like the community could be tipping towards. And so I thought it was very important to do that story. And it's not, like I said, it's not always easy, but you have to if you want your story to be authentic and just go beyond episodes and anecdotes, you have to go out there and you have to beat the bushes. And people, once you do that, people will lead you to other people in these communities, or who are involved in a certain issue. And so, that's how I do my reporting. Back at the Inquirer, of course, I did just as many stories with the police said, because you're on deadline, and it's it's just what you've said. It's this kind of police being the narrator, and those are not the best stories, obviously, but it is what it is in journalism. And sometimes you do have to just go with what you've got on deadline. But with the Trace, it's a great environment to let people tell their stories, and that's what I try to do.
Yeah, I was looking at a lot of your clips, and in your career, you like you said, you've done that beat reporting where you're filing 500 words to your editor about last night's shooting, which are stories that we all have to do at some point in our careers, and we all do in journalism school. What advice would you give like a new beat reporter who's sent to the scene of a shooting and wants to go beyond the sensationalized coverage? What are some things, given the deadline intensive environment, that they could be focusing on or asking? Like you said, not as much reliance on the police, but maybe some other things.
I think that beat reporters should understand that young reporters should understand that they're a brand. They need to really see themselves as a brand name, not just the company that they work for, but themselves. And they should get their cards and pass them out liberally, and always be thinking about the better story. Maybe you have to do it quick today, but there could be a comeback story, and you won't be able to get everyone into this story today, but people who you meet and talk to, you can come back to them and do a bigger story, a story explaining what's going on here, if it's warranted. So I would say to always just, keep your antenna up, not just for what happened today. I've done some great reporting looking at when you connect the dots, you realize, boy, I keep seeing the same thing happen. I did a story of this summer before I got to the Trace about, self-defense is on the rise. Self-defense shootings deemed to be justifiable, shooting, homicide. And the day I went out to one, I said, I went to a scene and I said, there was 3 or 4 more like this, just, in the last 3 or 4 months. And so I did a quick one, and I came back to it, and the Inquirer really liked it. They put it across the front page. So always be thinking that there could be more to the story than just what you see today. Try to meet as many people as you can, give out your business card, and always get numbers, get cell phone numbers always, to build up your contact list of people in the communities that you're covering.
So we're at the Trace, we're doing this hybrid kind of project where we have, a staff writer paired with an engagement reporter. And so Medsa, you work alongside our engagement reporter in the Philadelphia Bureau, Afia Tucker, who actually just wrote about Dr. Beard's study last week. I was just wondering if you could tell us a little bit about how this is going to work, like how your roles differ and how much opportunity is there for collaboration?
Okay, well, I've been here now since September. Afia came a month or so after me. So we haven't had a lot of time to, work together. But, I am the beat reporter. So I do the news. And then she's the engagement reporter. She's doing, she's more in community. I don't want to say community engagement because that's what she is, the community engagement reporter. But she, she's working on, she has a repository of resources for the community called Up the Block. And, this is it's giving with regard to mental health counseling. There's, organizations, programs for that, victim compensation, community organizations working on, solutions to crime and violence, after school programs for children. There's just a compendium of organizations in the Up the Block on the website. And so she's, engaged in that kind of work, working with community groups. I understand there's going to be forums at some point. That's part of her work. Whereas with me, I'm just like an old-fashioned reporter, who, what, when, where, connecting the dots, doing stories on trends. So far, I've done most of the work I've done is looking at unfortunate, side of life, of course, and I look forward to doing positive trend stories as well, things that are happening for the good. But among the stories I've done are looking at how gas stations have become magnets for carjackers. The shootings and robberies at gas stations are way up. I was able to do a piece on how public workers, municipal workers are getting more, and more caught in the crossfire. The water department, sanitation workers, recreation department workers. I've been taking a very in-depth look at, city leaders and the job they're doing, including the district attorney and the police commissioner. And I've written about how how gun violence is, shaping the upcoming mayor's race. 6 of our 17 city council people have resigned to run for mayor, and the number one issue everyone seems to agree is gun violence. So I've done a lot. That's I really cover the waterfront, when it comes to the issue of gun violence in Philadelphia. I'm just looking forward to do more. It's a much different pace than the Inquirer, and I'm getting used to slowing down, and there are a lot of times I want to write the story of the day, but I can't do that at the Trace. So I'm still in my learning phase, I guess you could say.
Absolutely. So yeah, just a little background. Up the Block is the foundation for our local reporting initiative. And it's our effort to offer services and resources for people affected by gun violence, as opposed to, just writing stories about them. We're actually hoping to create networks of communities that can support each other and be a part of that, as opposed to this kind of exploitative journalism model that we're really fighting against. So that brings us to Justin, who is our engagement reporter in the Chicago Bureau. And Justin, you came to the Trace 9 months ago from City Bureau, where you were publishing fairly regularly. And a lot of the work you do now involves listening. and letting people on the ground set the news agenda. So can you tell us what this listening tour has entailed and what you've been hearing from people there?
Yeah, for sure. So the first 6 months of my role or my time at the Trace was really trying to be out in the community as much as possible. So like attending block parties, back to school drives, farmers market, even. So really just trying to make myself as visible and available to communities. And we prioritize communities in Chicago that experience the most shootings, and so trying to be as visible in public space as much as possible. And really what I was doing was I was conducting what we call these conversations or engagement conversations, and they had like a specific structure to them. And so it was really us trying to figure out 3 different questions. Sorry if my internet is bad, but we were trying to figure out like what are people's perspectives on gun violence news in Chicago? What information do people need to better navigate this issue? And what media product could we build in place of the local infrastructure or news infrastructure that could better serve folks that are directly impacted? And honestly, we were hearing of what Dr. Beard already spoke about over reliance on police narratives and over sort of an inundation of death and death tolls and body counts and tragedy. People feeling like something that was also very common was people feeling like the city that they were experiencing in real life and the media that was given about Chicago, where there's a huge disconnect, right? Like it was sort of pathologizing Chicago in a way that people were very unhappy with. And people obviously people need material structural change, right? Like people need housing, they need opportunity, they need schools that are invested in. And there's only so much me as a journalist that I can do, but I feel like we were trying to figure out, okay, what information needs, like as journalists, can we fill? Like how can we at least point people in the right direction or create something that's a bit less extractive? Because historically here, as we've already heard, like journalists come to you, maybe they'll get a quote and like you never see them again. And so the survivor, or wait, I don't think you asked me about this yet, so maybe I'll just stop there. But those are sort of some of the things that I heard. Also, something else I want to point out is a lot of people said they want to hear more positive stories, right? Like I think Mensa was touching on this, like people aren't passive victims in their lives. Like communities aren't just experiencing this crisis and like going on about their days. Like there are mutual aid, there are nonprofits, there are church groups, there's a lot of community and love and resistance to this issue. And I think it's important that journalists don't just focus on the tragedy, but focus also on like how communities are responding, how they're coming together, how they're building networks of love and care. And they're not sort of like passive victims. And Chicago's not this flat landscape where, there's just gunshots everywhere. So really bringing back that side of the conversation, really allowing people like a more nuanced, more human take on the issue is what a lot of people were like calling for.
And it's especially important because we hear so often Chicago and Philadelphia being used as a political punching bag, and this really fights against that. So Justin, you just launched a storytelling network where you'll be helping gun violence survivors in Chicago learn the skills to tell their own stories. The project is still in the application phase, but what can you tell us about how that's going to go?
Yeah, so I think at City Bureau, which you mentioned, a big part of their approach is that in order for, journalism to survive like this era of, chaos that media finds itself in, is we have to get more people involved in like news making. And we have to sort of democratize and horizontalize like our news gathering, our news making structure. And that if journalism really is a public good, then the public should be able to do it, not just me like in my ivory tower, and I get to like hoard all these skills and all this knowledge and determine what is news and what's not. And so really, I think the least extractive way to tell stories about survivors of gun violence is really to allow them to tell it, right? And not even just through me, because I think even through me, I can be as people-centered and as community-centered as possible, but I still am framing things, right? Through my own biases, through my own, even the quotes that I pull out from an interview are mine, right? And I think we need to like really think about that as well, like who we give the mic to, right? In our stories is really personal, and it's really through our own lived experiences, biases, et cetera. So I think for us, it's like, how do we pass the mic to the people who are closest to the issue? And so through this storytelling project, we're going to get a cohort of, I want to say like 6 to 10 survivors. They're going to meet over the course of 3 months in person at these workshops where we're going to teach them sort of like the basic to storytelling and the basic to like, what is a nut graph? What is a lead? You know, sort of like, it's sort of like journalism, storytelling boot camp in a little bit, in a way, and really sort of work with them, edit their stories, and package them in a way and publish them. They become published writers. Yeah, so that we could sort of like pass the mic and decenter ourselves as much as possible. And they are paid a stipend. They're gonna get paid $700. And then we're looking for a trauma-informed storytelling coach who can create an environment that is safe for them. And then can also help teach them these sort of like practical journalism skills in a way so that, you know, if they want to continue to be writers after this, or they have the skill set to do so.
Wow, that is really exciting. You know, like you were saying, a lot of reporters kind of take on this like paternalistic role when it comes to the people they write about, like, you know, my job is to tell you the story and I get the final word. And that's what's taught in a lot of journalism schools. But do you see this project and this way of reporting as something that can actually change reporting practices to the point where it like becomes a unit in journalism school?
Yeah, I hope so. I hope that like journalism becomes a lot more like a community process, right? That like more people are involved, more people get a say at the table and get to say what stories get told about their own communities, right? For so long, historically, especially in a place like Chicago, what people learn about communities here, especially Black and Brown communities, is not told through community voices, right? Like we don't. And so I hope that at least here locally, like more newsrooms figure out and build infrastructure and build ways for community folks to set the agendas, for it to be more collaborative, and again, like more horizontal, more democratized, so that people get a say in how they're represented and how their community is portrayed. I hope so.
Absolutely. This has been really, really valuable and informative. And I'm so glad that everyone can hear from all of you, because I've heard about your work and I'm a big fan. Even my colleagues at the Trace, big fan. So this is really great. I'd like to go around and just kind of get from each of you one thing in the media that you would like to see change, like immediately, the top of the list of your pet peeves of, say, harmful coverage that right away reporters should stop doing. Let's do a lightning round. Dr. Beard, why don't you start?
So I mentioned this idea of how episodic crime reports on shootings are harmful to the survivors of firearm violence. So if I had to, change one thing, I would just say those have no news value. Only half of shootings are going to make the news anyway. So I would say if we could stop those and imagine alternatives. I think, we know from research now that they're harming people, but I think the larger societal harm is this reinforcement of the efficacy of law enforcement responses to firearm violence and the diminution of community-based approaches, which, as we heard before, are the evidence-based, are the effective approaches, are the approaches that are creating collective efficacy and that are preventing firearm violence. And just kind of one more comment in discussion with some of the other panelists, we heard how policing is an easy response to gun violence. It's also a harmful response.
Okay. It is causing harm. It is part of this system of structural racism that is at the root of gun violence.
Mensa.
I would just piggyback on what the doctor said. I think that journalists depend way too much on the police, what the police have to say. They here in Philadelphia, they love to call press conferences, and everyone comes running, and I just really hate that how they spoon feed us, and they then can lead you. They can kind of control the narrative, and they can be quite thin-skinned and hostile when you go off off of their script, and ask them questions that they were not prepared to answer. I like to do that, I just think that most reporters are just lazy, and they don't know, they're not specialists, right? So they jump around from a fire to it's cold outside to the team is in the playoffs. So they just rely too heavily on the police. And so often the police don't know what the hell is going on. I see oftentimes that they get things wrong, all the time. And then reporters don't know better. They didn't go out to the scene. They just regurgitate the error. So yeah, maybe it's a workforce issue, and stations, papers don't have the resources to hire people to sort of specialize. But if you're not a specialist, it's easy to be spun, And so I would say that please, journalists, don't take the what the police say as the word from the burning bush, or the Holy Grail. It's not. Just be more critical. Be critical.
Justin.
Yeah, I would say something that came to mind was something someone I spoke to throughout my listening tour, Jesse Fuentes, who runs like the Puerto Rican Cultural Center here, or the violence prevention program at the Puerto Rican Cultural Center here in Chicago, told me is that like gun violence is everything that happens before a shooting and everything that happens after it. It's not just like that particular incident. Like this doesn't happen in a vacuum. And I think what reporters can learn from that is like really situating things into a larger context, right? Like instead of just reporting on a neighborhood that experiences or has high levels of gun violence, but like what is the history of that neighborhood? What's the history of disinvestment? What's the history of racial segregation and policing and just racism in that neighborhood, right? Like in that context is directly linked to the violence that community is experiencing. I think like as a reporter, like thinking sort of macroly and like what is the sort of historical context to this? Like these things don't just happen in a bubble. They don't just happen in a vacuum. There's reasons that are systemic. And I also think another one that I would say is like, I know like editors want you want engagement, you want people to read your stuff. And sometimes like resource lists are kind of like, oh, we've already, like IRO.
We have Justin. I think we may have lost Justin, but we love you, Justin. Dr. Jessica Beard, Mensa Dean, Justin Agrello, thank you so much for joining us today. This has been really great, and I'd like to throw it back to the organizers. Eleanor.
Sorry, my internet went out.
Well, thank you so much, Justin. And thank you so much, Jennifer and Jessica and Mensa. You guys were fantastic. And thank you for all of our panelists that joined us today. Thank you for everyone for joining us virtually for our first convening From Sorrow to Solutions, the first of 12 such convenings over the next 3 years for the Amsterdam News Initiative, Beyond the Barrel of the Gun, addressing gun violence in Black and Brown communities through journalistic solutions. By being with us today, you are part of the solution. We'd like to thank the underwriters who have made this virtual convening possible, The Trace, an independent, nonpartisan, nonprofit newsroom dedicated to shining a light on America's gun violence crisis and common justice that develops and advances solutions to violence that transforms the lives of those harmed and fosters racial equity without relying on incarceration. We'd also like to thank our partner, the Clinton Foundation, where we are broadcasting today. I'd also like to thank all of our staff at the Amsterdam News who have worked tirelessly on putting this together. With me here are Josh Barker and Siobhan Bennett. Thank you so much for being the behind the scenes tech team. You have done a phenomenal job. And to all our other staff members who have worked tirelessly on this project. So now please consider investing in our work to address gun violence in Black and Brown communities. No gift is too small. Get your cameras ready for the QR code and link. Again, by being with us today, you are part of the solution. Thank you so much and have a very good evening. Take care.